morning, Chair and everyone.
Good morning, Member Van Voog and everybody else.
Good morning. Good morning to everyone. The clock does indicate 8 o'clock. I wish to welcome all members, all Minister Mbombo, Dr. Kluter, all departmental officials, as well as all guests to the Standing Committee of Health deliberations this morning on Wednesday, the 17th of March 2021 at 8 o'clock. Please feel welcome to everyone. I just wish to indicate in the beginning that today's session will be conducted in two parts, of which the first part of the meeting is for the committee to deliberate on vote 6, health in the schedule to the Western Cape Third Adjustment Appropriation Bill B3 of 2020-2021 financial year, as well as part 2 of budget estimates for the 2021-2022 of the health department. Colleagues, can I just remind you of the cardinal rules of online engagement? Can I at this stage kindly ask the procedural officer, Ms. Junket, to just manage those members, officials or guests that are still in the lobby, to kindly admit them as soon as possible. I will now ask everyone on the platform to kindly mute themselves as well as to turn off their videos. I think it will be critical for us to have a stable connection today. Members, we are also hampered by load shedding in various stages of today. So kindly indicate in the sidebar if you are affected at any point, in order for us to take note of that as well. So yes, please members, turn off your mics and your videos. You are most welcome, whilst you will be engaging, to turn on, of course, as well. Members, if you wish to raise a point of order, kindly raise your hand, or you wish to ask a question, you are also welcome to place, should you not be able to find your raise your hand function, to kindly indicate so in the sidebar. I will now allow members of the committee to introduce themselves, after which the department, and then after which guests. You may please proceed, members.
Good morning, Chairperson Lorraine Botha.
Good morning, Chairperson and members and officials, Regan Allen.
Morning.
Good morning.
Good morning, Chairperson and everyone. Rachel van Vogel.
Good morning, Chairperson Ricardo Mackenzie.
Good morning, everyone. I'm Gladys Blackburn-Force.
Good morning, Chairperson Ayanda Burns.
Is that all, members?
Goeiemôre voorsitter, Dylan Mitchell.
Good morning.
Good morning, Chair and the members, Melika Yatak.
That if that is all, members, the department can proceed.
Morning.
Good morning, Minister.
Morning, honorable members, staff from 5th floor, and also, from Parliament, and also from the department. Dr. Klute will introduce who's here, but from my office, I've seen a corner, I think Douglas Nomawetu are here. Thank you. Over to you, Dr. Casey.
Thank you, Minister. Good morning, Chairperson. Good morning, members of Parliament. I'll introduce the members of the Health Department that's present today. The first one is Mr. Simon Kay. He is the Head of Corporate Services and the Chief Financial Officer. Dr. Sadi Karim. He is the Head, the Chief of Operations. Dr. Chris Valabji is the Head of Strategy. And then as part of the finance team, we have Mr. Glenn Carrick. He's currently the Acting Chief Director for Finance. We have Ms. Desiree Mohanis, she's the Director for Budgeting. We have Ms. Krishna Low, which works in the budgeting program. Mr. Saleh Ahmad Khatri, he does all our work in relation to revenue. And then Mr. Eugene Brown, he works with Dr. Angelette Dutoy. Dr. Angelette Dutoy is also with us. She is the Chief Director for Facilities and Infrastructure Management, and Mr. Eugene Brown is the Finance Manager for Infrastructure and Facilities Management. Thank you, Chairperson.
Thank you very much, Dr. Klute. Do we have any guests on the platform this morning? You may now introduce yourself, please.
Good morning, Damaris Kiewits, Cape Metropolitan Health Forum.
Good morning, Ms. Kiewits. Any other guests this morning? Not? Thank you very much. We've got a very full complement. Any apologies? None from members, none from officials. Ms. Jamke, did you perhaps receive any apologies?
Morning, Chair. Morning, the guests and members. I did not receive any apology for this meeting. Thank you.
Thank you so much. Today's committee engagement is a meeting as well as a public hearing. So the first session of the meeting, as mentioned, The committee is going to deliberate on vote 6 held in the schedule to the Western Cape Third Adjustment Appropriation Bill B3 of 2020-21 financial year. After the department has finished reporting on this third adjustment appropriation, the members will then have an opportunity to ask questions. And once all the questions are answered by the department, the committee will then also allow members of the public to make submissions on the third adjustment and ask questions should they have any. And of course, we will then request the department to respond accordingly. Members, you will note that you have received the presentation by the department. I think it was emailed yesterday, pertaining to vote 6, 2020-2021 third adjustment appropriation, vote 6, 2021-2022 budget allocations, as well as budget priorities, and which also included some concluding remarks from the department. At this stage, members, I will now hand over to Minister Mbombo to give us a brief overview in terms of remarks, after which Dr. Kluter can also provide us with a brief overview if there's anything that the HOD wishes to add on to what the Minister has said. Can I kindly request, for the sake of time, that we do not go in the excess of 5 minutes, if that is possible, please. Minister Mbombo, thank you very much, and a warm welcome again. Over to you. Thank you.
Thank you, Chair. Can I just clarity, are we going to do the 2020 adjustment, get done, and then we do the remarks for the 2021?
That's correct, Minister.
Okay, so it means I'll only speak for 1 minute for 2020, and then I'll do the remarks when we do the new year, which is the 2021.
Yes, that's correct.
Okay. Yes. Thank you, Chair. I think I'll reserve most of my remarks when I start with the 2021. For the adjustment for now, it's 160 million, which is an additional to the 27.97 billion from the second adjusted appropriation. Now, with the third adjusted appropriation, it's 27.213 billion, which the department will elaborate in terms of what is the money for. Taking note, Chair, now we the date today is the 17, yeah, 16, yeah. The date today is 17 March. This is the money that needs to be utilized by 31st of March at the end of the financial year. So that's why I won't dwell much on that. The department can be able to share about that. I'll speak more when I appropriate the 2021 budget. Thank you, Chair.
Thank you very much, Minister. Dr. Kluter.
Thank you very much, Chairperson. Similarly, the third adjustment appropriation bill for 2021 is exactly what it says. It is the third time that we're coming to this committee to introduce the adjustment. It's quite unusual, and it's an unusual time that we actually come to a committee 2 weeks before the end of financial close for a third appropriation. And that is just testimony to the unusual year we've been through. And I really would like to, the only thing I would like to say is that we will be very explaining what the 116 million is for and how that influences what we do for the last 2 weeks of the financial year. But within that, I just want to give testimony to all the health workers in the Department of Health that have come through this very unusual year in this extreme disruption, that they've been able to maintain a service, that we are still here. We have done what we could. We have responded with agility, and we've responded and done our tasks, I think, commendably in the face of what we face. While all of this, we also, recorded a clean audit during this year, which is a phenomenal achievement for the disruption that this department faced. And while doing that, our team, especially the finance team, had to keep afloat what happens in terms of financial structure and budgeting in this very unusual time. In terms of when we started this year with a budget, we had no idea how much money we're going to spend, on what we're going to spend it. And for a finance team, that is the most unsettling thing to go into a year. Because what we normally do is we budget and then we spend according to what we budgeted. This team had to learn in the space of the last 12 months that you can budget for something, but you're not quite sure what it is you're going to spend your money on. And you have to adjust midstream. So I really would like to take my hat off to Mr. K, Mr. Carrick, Ms. Mughani, and the entire finance team, and across our entire department, for how they've responded in the face of this, together with our relationship with A, the Auditor General, and then B, our relationship with Provincial Treasury, to get us to this point where we have a third adjustment in terms of the impact of COVID, to be able to come and to do what is responsible and not record unauthorized expenditure for this year, which we hold dear in this department. Chairperson, thank you very much.
Thank you very much indeed, Dr. Klute. At this point, can I ask the departmental official responsible for flagging the mentioned presentation kindly proceed?
Thank you, Chairperson. That will be Mr. K. Over to Mr. K.
Thank you.
Good morning to the Chair. Good morning to the honourable members. Good morning to the Minister, to the HOD, to the colleagues and the guests. Can I proceed just to briefly share the presentation?
You are most welcome.
Thank you very much. Let me go. Chairperson, are you able to see the presentation?
Yes, we are. Thank you.
Thank you very much. I have prepared one presentation because we're dealing with two appropriations, but I will stop at the end of the third appropriation, and then when we deal with the next year's budget, I will then take off from there. So, as I said, we're just looking at the third adjustment appropriation for now. Minister has already indicated we are being appropriated an additional 116 million rand, which takes us up from 27.097 billion to 27.213 billion. It's a small increase of 0.43%. This is where we have allocated it, and I will spend a little bit of time here just explaining why. The lion's share has gone to district health services, and then there has been a smaller adjustment, an amount appropriated to the provincial hospitals. This was primarily because of the second wave and the impact that the second wave had on our primarily our district hospital platform. You will be aware that the hospitalizations were much higher, the infections were much higher, and it impacted even the smallest facilities that we have in the province. And therefore, in December and in January, we saw that there was significant pressure that was developing in particularly Program 2.9 in the district hospitals. On top of that, we had initially budgeted for the Brackengate Hospital of Hope. We had initially anticipated that that facility would no longer be required at the end of January, and had it budgeted accordingly, unaware of the impact of what the second wave was going to have, and therefore we needed to continue, and we continue Brackengate going forward, but we needed to continue Brackengate for the remainder of the financial year. And on top of that, the Stormstroll facility in the near Paarl was also came online and was also under a fairly significant amount of pressure. So the long and the short is that is where the money was allocated. A significant amount of it went to compensation of employees because we needed to supplement and complement our current staff numbers because of the number of infections that were happening and the number of people that were sick, as well as the number of additional patients that came in. And there was a fair bit of pressure that came on into goods and services. So particularly if we look at Brackengate as an example, it is on a contract based on the number of patients that were coming through. And therefore we needed to add funds into the goods and services. So there was also a small amount that needed to go to the non-profit organizations, and that was based on some pressures that were coming through there. So as I've said, the reason is primarily, it's all COVID-related activities. It's earmarked from equitable share. It's related to staff facilities, field hospitals, and PPE. So Chairperson, that is the short and the sweet of the 116 million rand. If I can leave it there and hand back to you. Thank you, Chair.
Thank you very much, Mr. Kay, for presenting to us. Members, we will then now table the third adjustment appropriation budget as a whole. If you have your books from page 27 to 30, and you would have noted the annexures on, or rather from pages 31 to pages 33, after which members can then ask their questions. Ms. Jamke, are we flagging those pages? Member Mackenzie?
Thank you, Chair. Just for one question. I only got one question on this.
Can I ask that we do it collectively?
Okay, that's fine. Yeah.
Thank you. Ms. Jamke? Are we flagging the pages or are we asking members to follow either on their emails or in their respective books?
Members must ask from their books, Chair. We are not flagging.
Are we not flagging? All right, members have
Yes.
the information to their disposal. So I'm tabling now pages 27 to 30. Members, you have the information, you have familiarized yourself. So members are now welcome to ask questions on those pages, as well as what was presented to us by the department. I recognize Member Mackenzie.
Thank you, Chairperson, and thank you for the presentation. It's very self-explanatory. I just want to have one question on this particular, on the two facilities that mentioned, is the Brackenhope and the Sonstraal. Are we envisioning now, given that we've now allocated staffing and budgeted for that, is there a timeline as to how long these facilities will stay? Because we are expecting level 3, as we've seen globally it happens. And are those facilities going to stay open until for the next 6 months, for the next year? Is there any indication from the department as that? And have they modeled in any way what might be needed? Or will we be covered? I mean, it's not the guarantees. It's probably an unfair question to ask because we don't know what level 3 will deliver to all of us. But I know that we've now got permanent facilities in Lentegeur, additional 200 beds. Are they comfortable that should level 3, for example, be double than what we have in level 2? Will our facilities be enough? Thank you.
Thank you, Member Mackenzie. Any other members? From my side, members, I don't see any other hands. Please correct me if I'm wrong. No hands. Thank you. At this stage, Ms. Kivitz.
I'm good.
Are you well? Okay. That's wonderful. The departmental official or minister that will be answering to Member Mackenzie's question.
Go ahead to respond.
Let me answer that question. It will become obvious in the next presentation, because what we've done is we have funded both Brackengate and Saunstraal for another year. On top of that, so Saunstraal is our own facility. On top of that, we've signed, the province has signed a lease agreement with the landlord at Saunstraal, at Brackengate, for an initial period of 3 years with it's a 5-year lease with an ability to break after 3 years, as well as a potential to add on an additional 2 years on top of the 5 years if that need should arise. So those two facilities are going to be there, and depending on what happens over the next year, we will then have to look at whether those need to be funded beyond the end of the current financial year. So I hope that answers. In terms of the modelling, I'm not the expert in the modelling, but we are being, and you'll see when we present the main appropriation, there is fairly substantial investments from a provincial perspective in COVID, looking after the third and the fourth wave potentials, as well as the vaccination program. But we'll present that a little bit later, and then you'll see what we've put together. Thank you, Chairperson.
Thank you very much, Mr. Kay. Members, any questions on the annexures, pages 31 to 33 at this stage? No questions from members? Thank you very much. Ms. Jamke, I just need you to indicate, are we now moving over to the second session?
Yes, Chair.
Still on the right page. Thank you very much.
Yes.
At this point, I will now again request Minister Mbombo to give us a brief overview of remarks on the budget estimates for 2021-2022, after which the HOD can then also add on. You may proceed, Minister Mbombo.
Thank you, Chair. Today I'm presenting for the appropriation of the budget, Western Cape Department of Health, 27.31897 billion for 2021 for 2022. Honorable members, it's my 6th year in this portfolio. For the first time that I have to present a budget where there have been a decrease as a result of the national in regard to allocating budget to the health sector as a whole. You may see in your books in regard to equitable share what has been there previously, and also what has been allocated here. Probably the 0 point plus percentage might not seem as a minor, but every cent counts. You'll see the major blow, it is the conditional grants, which have been decreased, meaning that the whole of our budget would have been actually lowest if it wasn't about the provincial treasury from their funds, from the provincial funds to rescue us. The worst scenario, it will have been where we will have to let go in regard to reducing our staff. I don't even know how you reduce staff when you need more staff, because when it comes to health, there's never been more. You will need as many as you can, especially in regard to where we are now in regard to the COVID. So at least that part, for that part has been saved. Thank you for, as you heard from the provincial treasury yesterday. This budget comes at a time where even pre-COVID, we had challenges regarding to the quadruple burden of disease, meaning the maternal and child health, the mental health, the chronic conditions, violence, trauma, among those. So it doesn't mean those have been on holiday. And then you add a layer of the COVID. So you can imagine how COVID will and has impacted on this quadruple burden of disease, where across the country we've seen an increase in maternal deaths, where women are unable to attend antenatal care or health services across the country. We have seen how child health, luckily with the immunizations, it didn't decrease because in the rural areas, the mobile clinics never stopped, they continue. You'll see in regard to the trauma and violence, although during the time of the lockdowns, we'll find that they will decrease. But now that we are open up, it's going to increase. It also comes at the time of social determinants of health, which is the issue of unemployment, the issue of the inequalities, the issue of the decreased economy. It will impact on us, as we know that health absorbs everything. It comes at the time where we're busy with the vaccine rollout, which is quite slow in the country compared to other countries. So that Rwanda, I think 140,000 people, health workers vaccinated within 2 days. Whereas in South Africa, it's about 6,000 per day for the whole country. The uncertainty in regard to the third wave, and also uncertainty in regard to not confirmation, unconfirmed yet about when we're going to get the vaccines for the phase 2, it has got a major impact now when I finish off, Chair, in regard to non-COVID services, because we've de-escalated as many of the non-COVID services, but we try to recover those that have got a high impact and might have dire consequences if we don't bring them back, which is the child health, the TB, the HIV, among those. But in my worry more, it's about the mental health status of our healthcare workers. In addition, that they will have to deal with the communities where not even about the COVID, that also have got mental health issues, as we know what has been the impact around the COVID. So, Chair, we're bringing a budget where the issue of our healthcare workers, emotionally, psychologically have been impacted. We're bringing a budget where we have to de-escalate some services or not bring them back because we don't know the answer about the third wave. We're bringing a budget when in the country has got the most, it's the most time where we find that our socio-economic challenges has affected the country more than any. And it is this budget where we find that in the next MTEF, it is decreasing. You have never seen a situation where a budget has to decrease throughout for the next 3 years. So it means that we have to rob Paul and pay Pauline. Hence, you'll find that when you're going to ask me, when you're going to build new clinics, we don't have that provision, except for those that have already been planned, but we don't have such. Same applies that when you're going to add more on your recouping the issue of the surgeries, it means that we won't be able to. But there are many other innovations that they'll be presenting now, for example, to escalate their chronic conditions, medications that has to go throughout. The addition in terms of the staff wellness, you'll see some of those additions, and also some of the services related to the mental health. So thank you very much to the staff from the management and also up to the staff at the periphery level for being there throughout. It has never been any other time, not only myself in my period as a politician, but also as a person who has been in health forever, that we have seen health to be such in this kind of a condition throughout the country, and also where we find that the cracks in the health system is being exposed because of many other variables that have been left behind throughout the whole system. I hereby table and appropriate for 27.391 billion budget. Thank you, Chair. Department will add more.
Thank you very much, Minister Mbombo. Dr. Kluter, you may proceed.
Thank you very much, Chairperson, and thank you to the introduction from the Minister. I would like to start off, Member Philander, to say that I'm 2 weeks short of my first year as the accounting officer. So I'm still 11 months and 2 weeks an accounting officer. I would start to say, as an accounting officer, I would not have predicted what the last year would have been about. And really like to acknowledge the massive impact that COVID has had. COVID has reset, I think, the world, has turned the world upside down, has reset healthcare systems everywhere, has reset the healthcare system and society at large in South Africa and in the Western Cape. And there's probably not a single person on this platform that's not personally been affected by COVID. So as we start the discussion on a budget, I would like to start and pay tribute to the 11,500 people that lost their lives, generally in society in the Western Cape, and the 133,000 staff members of our department that lost their lives. I would never have imagined starting a year as an accounting officer. I will come to the end of a year to have to start off my conversation with the lives that's been lost. And really just in terms of that, the collective grieving and that we all have to go through as a department, as a society, and the collective acknowledgement of the hurt and the pain so that we can heal and move forward. So I think it's an important introductory point for me. The second point is what COVID has done, though, it has taught us a lot of things about ourselves. And we have learned in the past year that if challenged or if faced with a massive challenge, we can respond in a way that we can be proud of. So the agility, the ability to pull together a hospital of hope in the CTICC in a space of 2 weeks, to be able to house patients and then to successfully decommission that hospital. But then 4 months later, successfully commission a hospital of hope at Mitchell's Plain Hospital while there were patients in the beds on the 16th of December, and still have 200 beds with oxygen, with staff, so that people can be admitted from the first week in January, is testimony to what can be achieved in a system like ours. And it's testimony of how proud we are of being able to be associated with the many people behind the scenes that make our system work. And we've learned so much from a human perspective of how to respect one another, how to work together, and how to value relationships, but amongst ourselves, but also with people outside our department. And that brings us then to 2021. So this budget that the Minister is putting in front of everyone, and me as an accounting officer are signing off for you here in today, has got 2 or 3 big challenges in it, and the Minister started relating to it. The first one is COVID is not finished. A third and possibly a fourth wave will be coming during this financial year. The first thing is we need to have learned from the first and second wave, and we need to be ready for that. The second issue is we're about to launch a vaccination program of the scale that we've never seen in this country. And for us to vaccinate 5.1 million people in this province, we have to go, and Minister, I can now report to you. I'm quite proud of that. Yesterday was the single biggest day of the vaccine program in the province. We exceeded 2,000 vaccines yesterday in one day in this province. But that 2,000 vaccinations we did yesterday has to become 25 to 30,000 vaccinations per day over the next 2 to 3 months. So scaling up to be able to vaccinate more than 30,000 people per day in this province is going to be one of the key challenges that we have to get right. We have to scale it up, we have to do it quickly, and we have to be able to work with everyone to be able to do that. That's the second big thing for this year. But the third big thing is probably the most concerning one for all of us. And that is what happens in the field of non-COVID care. And that is what we, in a sense, have had to defer. But the problem is with care that you defer is when it comes back to you, it escalates. So all deferred care escalates. And we are sitting with challenges all the way from immunizations, which our teams have really successfully been able to mitigate for immunization for children, But if you think of the deferred care for TB and HIV, if you think of deferred care for mental health, if you think of the deferred care for surgical interventions, especially urgent and elective surgery, it comes with a big toll. And it's from that perspective that during the time that we have to manage and mitigate the third and fourth wave, we have to scale up vaccine. At the same time, we have to reset ourselves to be able to say, how do we redesign what we do? How do we govern differently? And very importantly, how do we work with all other stakeholders to mitigate successfully over the next 3 years? What I would call the reset, to be able to do all the non-COVID care we have to do to minimize the impact in the long term. So with those, therefore, the budget that's being tabled is one that is a decreasing budget. It is calling on us to be much more resilient than we've already been. And the journey for the next year, leading into the next 3 to 5 years, is going to be an extremely difficult one. But we want to walk a path with everyone, every single sector of society in this province, to do this all together. Thank you very much, Chairperson.
Sorry, members. The chairperson is struggling with connection. Can we take just a minute break until we should reconnect again? Then we'll be back.
There will be load shedding as well at 10, just in case. Probably I have to change devices as well, and I'll be out of the camera just to assist with the bandwidth.
Noted, Minister.
Members, Minister, Dr. Klute, are you online? Member Botha here. I'll continue while we are waiting for the chair to join.
Thank you, Member Botha. If we can proceed on to Mr. K.
Okay, Dr. Klute, before we get to Mr. K, I just wanted to give an opportunity to members if they wanted to pose questions on both your and the minister's overview. Members, any questions that you want to pose at this point? I note Member Mackenzie.
Thank you, Chairperson, and thank you, Dr. Klute and Dr. Norma French for the work done. The last year has definitely been, despite the fact that it's been extremely horrible and sad what happened, I really have to give kudos to both of you for your professionalism and the way you've handled this pandemic. It's been extraordinary, so well done to both of you. And one will get into the detail of the budget when we go in later on, but I just want to get the principle, get an understanding of the principle going forward. As we know, we have Easter weekend coming, and I know I've raised it at the previous meeting before in a few weeks' time, on the thing that 3 weeks from now, 2 weeks from now. And after that, immediately we'll have the holy month of Ramadan. And I just want to get from the communication strategy going forward, and does the communication strategy include putting in preventative measures like masks to churches, hand sanitizing to churches and to mosques going forward? Because that is going to be our biggest risk, because families, we are human beings, we're social, we want to sell family. And I know previously, and Dr. Mafrench was in Heinz Park and we handed out masks during that period last year. I just want to get an understanding if the strategy to combat and prevent a massive third wave, except the role of us and the role of everybody else, because that is our biggest risk going forward. Thank you.
Thank you very much. It seems that it's only that question for now. Dr. Klute, are you responding to that? Thank you, sir.
Thank you, Member Botha. I'm happy to respond unless the Minister choose to respond.
Minister?
I think as Dr. Klute indicated that the COVID is still going to remain with us until or unless almost 70% of the population in South Africa gets vaccinated. Therefore, the first line of defense will always be NPIs, which is non-pharmaceutical interventions, irrespective. Because remember, even now for phase 1, the people who are being vaccinated are healthcare workers. And also, even within the healthcare workers, you still have to prioritize. So not all the 132,000 of healthcare workers will be vaccinated. And you know that even for the 1.2 million for South Africans, it's only 500,000 doses that we have. So it means that the whole lot, they are still at high risk in regard to in terms of the spread. We have seen actually even now some of the smaller outbreaks. We've seen in a school and also in prison. It means that there will be. It's not about that it's going to be a shock. There will be quite as many of those, because unless you avoid the gatherings, hence the message about stay in a bubble, the 3 C's in regard to avoid crowded places. The conduct settings still stick to the physical distance of 1.5 meter, and also in terms of the poor confined spaces, places like where you have to avoid the poor ventilated space, still going to be there. So wearing of the mask, washing of your hands, sanitizing, cleaning your contact surfaces at home with jig and water, going for shopping only when it's necessary. And also in regard to avoid like places like funerals and all of those. So it's still, the message is still there. But that message is not only should be carried by health in terms of the dissemination of the message. We do our part. It's everybody's responsibility, because COVID is not a health problem. It is now a social problem. And then in regard to the masks, by now that we're almost a year after South Africa, it means now that it's somewhere in the shops or everywhere, or even the NGOs and anyone could be able to donate masks. We did our first project when we were at the first project, the donation through the Ubuntu mask, where at least we tried to donate specifically among the vulnerable groups, like even the old age homes, also in the poor communities. But at this stage, as I've presented, that they were presenting a budget that is minimal. We won't be able to buy masks for everyone when we have to prioritize Panados or vaccination and all of those. So yes, NPI is still going to be there. Hence, our message is about if you want to avoid early third wave, whilst there's uncertainty in regard to when, but we have seen in the UK, in Europe already, they're already on the third wave. And unfortunately, in some parts, or like in the UK, with their variant is lethal, is deadly compared, for us, they still haven't proved that it is as deadly, but it's high transmissible. But the issues of those who are mostly vulnerable, which is those who are comorbidities, specifically the diabetes and the older persons, it means that we still have got the obligation to protect them. So the bundles, when they come back from varsity or when they're coming back from grooving and whatever, all of those, they must know that they still have to protect the older persons at home or those who have got comorbidity. So that's where things are. We can do as much as we can as health. The messaging is there. You see, even I've seen some of those even in the in public spaces, on the notice board, in ShopRite and everywhere. We find that they've got our messaging there, pamphlets and all of those. But it is everyone's responsibility to ensure that we avoid early third wave and we protect the vulnerables. Thank you, Chair.
Thank you very much, Minister Mbombo. Thank you very much, Member Botha, for standing in. My sincere apologies for that technical glitch. HOD, is there anything from your side that you wish to add at this point?
Thank you, Chairperson. Just two small things. For Member Mackenzie, the campaign, the heightened campaign is being launched this week again. So towards the end of the week, we will see all the messages hitting the media, as the Minister said. And secondly, we have a regular forum via Minister Meyer with all the religious leaders. We will be having an engagement in preparation for the holiday season with them as well. Thank you, Chairperson.
Thank you very much, Dr. Klute. Are there any questions from other members based on the overview? Any other member? Not? Thank you, members. Then we will now proceed.
Chairperson, I'm raising my hand, but it doesn't seem that you are seeing it.
Yes, unfortunately on the screen I cannot see it, but please proceed. Member Botha.
Just to indicate to you, I also saw Member Windvogel's hand raised, Chair. I just want to indicate to that.
Thank you so much.
Yeah, I just wanted to say to Dr. Klute, and what a year it was. And I want to acknowledge the department's clean audit, to the Minister and the HOD, and also acknowledge the warriorship and heroism from Dr. Klute, all the staff within the whole of the Western Cape Health Department, and label them as our angels of mercy. And I want to ask the Minister or the HOD, does not matter, in regard to the decrease in the conditional grant, if they could speak to what other innovations the department will embark on, not to reduce or make our service to our communities inferior. Thank you, Chair.
Thank you very much, Member Botha. Member Windvogel.
Thank you, Chairperson. Chair, I'm covered by the HOD in terms of programs. But what I also want to add, in addition to Member Botha's question, whether the department fully expended these conditional grants in the previous financial year, and if not, how much was the under expenditure? Thank you, Chairperson.
Thank you, Member Windvogel. Colleagues, unfortunately, from the screen that I am on now, I am unable to see your raised hand, so you may kindly indicate if there is another question, or if the procedural officer can also kindly assist me in that regard. No other questions, Minister Mbombo, and then Dr. Klute.
Chair, the presentation that's going to be presented now, because if you recall, Mr. K stopped short after the third adjustment. Now I was going to take you through to the presentation. Those questions about what are other innovations and also what are the grants that have been decreased is going to be covered there, because you don't want to preempt it, because it's still going to be repetition. I think then once after that presentation, before maybe we go through the page, then we can be able to respond, to add if there are any other shortfalls, but it's already there in the presentation. Thank you.
Sure.
Sir.
Thank you. Thank you, Minister Mbombo. That is clear. Mr. K, you can proceed.
Thank you very much, Chair. I'm going to share my screen again. And Chairperson, may I confirm that you can see my screen and you can hear me?
Yes, we can. Thank you very much.
Okay, thank you very much. Maybe let me just start off the question from Member Winvogel. We haven't yet finished the current year, so we are still spending against the conditional grants. We'll be able to report back on that at a later stage when we account for the 2021 year in terms of the conditional grant allocations, what was spent and what was applied for rollover. So we don't as of yet have that information because we're still busy with the financial year. So if I can then move to the 2021 budget, and I want to spend a little bit of time on this detail, if I may. So this basically shows us our various source of funds, being the equitable share, the conditional grants, as well as the provincial financing and departmental revenue. But it's quite important, and you'll see that I've taken out the percentages because we won't be comparing necessarily apples with apples. Our main appropriation for 2021, the first column, is basically our budget that we got last year before COVID, and also before the wage increase freeze was taken back by the National Treasury. Our adjusted appropriation, the 27.2 billion rand, includes the 116 million rand that we've got, and included a component of equitable share and conditional grant for our COVID-related activities. The 2021-22 year is what is being tabled at the moment. So we're receiving 18.9 billion rand in equitable share. We are receiving 6.9 billion rand in terms of conditional grants. However, you can see, if I look at the NTSG, in absolute terms, we've actually gone down. And this is one of our major grants where there has been a reduction in allocation. And the other one where there has been a fairly substantial reduction in allocation is the health training and resource development grant, where we have had a significant decrease in that. Also, our national grant funding for the COVID, that was for operations. What we've been given for the current year, the 156 million rand, is exclusively for vaccines. And therefore, as I'll explain and show a little bit later, the provinces had to, the Minister of Finance yesterday, Minister Mania, indicated the quantum that the provinces had to put from its own reserves to the continuation of the fight against COVID. That you can see is quite clearly shown here. The provincial revenue fund, so the money, the financing from the province, has gone from 329 million rand to 1 billion rand. So there is a significant contribution from the province into making up the shortfall in the conditional grants, as well as for funding the ongoing COVID-related activities, for which we are incredibly grateful. You will also note that, unfortunately, our revenue has also taken a significant knock. The whole health sector has taken a a significant knock in revenue. And we are compounded because the majority of road accident funds or patients are serviced in our facilities, and the road accident fund is becoming more problematic in its ability to service its debts from a cash flow perspective. So we've had a decrease in departmental receipts and revenue. We've taken that risk up front so that we don't have to decrease our budgets like we did in the adjustment estimate this year, when we realized that we were going to be 114 million rand short on our targets. What Minister was then identifying, as you can see here in the outer year, the MTF, the 22-23 year, we actually have a decrease in absolute terms from 27,391 to 27,318. And in the outer year, 23-24, we have a further decrease of 26.8 down to 26.895 billion rand. So the outlook, while we are funded for operations for this year and some COVID-related activities, the outlook over the mid and the outer year is not looking very good. And that's not only within the department, it's also within the province and within the national fiscal space. So you're seeing that is filtering down. But as Member Botha asked, we have to get very innovative to be able to continue to render the services that we are required to do within a shrinking fiscus. And we have got some time to transform the service and the way that we render the service. So that's our outlook over the MTF, but the 2021-2022 year is where the primary focus for today is, because that is where we are what is being appropriated today in terms of the budget. If I can then move to just a brief summary of where all of that money goes. So you'll note that administration is sitting fairly high. We have put the majority of our central COVID-related money, so the testing, the PPE and staff wellness, those funds are sitting primarily in Program 1, as well as some of the vaccine money, which we administer centrally, and that's why there has been a dramatic increase in administration from a program perspective, but there are very specific reasons for that. We still continue to heavily invest in district health services, but you can see again there is a downward trajectory. EMS is relatively flat. Provincial hospital services are also relatively flat. Central hospital services, these have been impacted by the decreases in the conditional grants, which we've spoken about earlier. Health sciences and training is also flat with a little bit of a decrease. And then healthcare training and support, there is a slight increase in that. And then the 1.1 billion rand for facilities. The major increase in the facilities is because of the additional funding that we got in the conditional grants as a result of we get an allocation for effectiveness and performance, and because we've been performing, we get additional allocations. So, members, you can see that the lion's share of our funds go towards compensation and goods and services. We then also pay our transfers and subsidies, which includes the non-profit organizations as well as the City of Cape Town. And this is the money that we spend on capital across the whole vote. So 356 on buildings, 623 on machinery and equipment, and a small amount on software, which gives us 982 million rand. And that reconciles back to our budget allocation. So this is just some priorities. I wanted to show here where we spend our money graphically, so you can see that there is a major focus on primary health care. and then central hospital services, and then regional and specialized hospital services. So really frontline is where there is a significant investment, and then program 3, which is EMS, also has a significant investment. I've explained the anomaly that sits in program 1 as a result of COVID, and then program 6, 7 and 8 are primarily the support programs to the service delivery programs. I just wanted to highlight a little bit of the earmarked allocation. So we have earmarked 1.1 billion rand for infrastructure. There is earmarking of 832 million rand for COVID. Let me spend a little bit of time explaining how that money has been allocated out. So this money comes from the province, is allocated to us through the province. However, there was an additional allocation that came out of the national sphere to the provinces in the form of equitable share for COVID-related responses. And that money was then passed through by the provincial treasury into our equitable share as a vote. We've looked at probably 3 or 4 large thematics around our ongoing COVID response. I'll break them down as follows. The first one is about staff.
Is it frozen or is it quiet from my side?
I cannot hear Mr. K at this point.
Mr. K does have internet challenges from time to time, Chairperson. Sorry about that, but I think he's back, or he's not back. He was talking about the COVID response money, and that 832 that you see there, that money has got 3 broad areas. The first one he was talking about is the staff that we have started employing as part of the second wave, and it's continuing paying for that staff so that we keep them in the system. When we need them, we deploy them accordingly. Mr. K, I just explained the first part of that 830, which is keeping staff, retaining them, and then and you can go on to the other 2 parts. Thanks, Mr. K.
Thank you. Thank you, Dr. Kuti. My humblest apologies. Technology has let me down. So yes,
from time to time. You're welcome to proceed, Mr. K.
Thank you very much. So, Dr. Kuti, I presume you've explained the 332 million rand.
Yes,
okay, thanks. And so that includes the Brackengate and the Sonstrol that I referred to earlier, Member Mackenzie. Then we've also invested 250 million rand in staff wellness and protection, which is PPE. We have established a central store which allows us to control quality as well as price that we are receiving, and then allows the facilities not to have to procure in multiple places. They are able to place orders against a central store. That has been one of the innovations that we have brought through, and we are seeing some fairly substantial savings that are coming through in the PPE space. But we've allocated 250 million rand into that particular space. And then the third space that we've allocated this particular money is into testing and surveillance. There is still a significant need for testing and surveillance. And so we've allocated 250 million rand into that particular space. And as I've said, the large majority, other than the 332 million rand, the other 500 odd million rand sits in program administration, program 1. On top of that, we have received an earmark fund for in staff wellness. We have been running a program on intentional grieving, as well as a number of other initiatives that have happened within the staff wellness space. I think one of our big lessons is we've really had to take an opportunity to breathe and to grieve as a collective and as individuals. Healthcare workers at the front line, in administration, as leaders, we have all been deeply impacted by what we have seen and what has happened. COVID has become a 360-degree risk and experience for all of us. Normally disasters you can see in front of you, but unfortunately COVID has impacted each and every one of us, whether it's at work, whether it's at home, whether it's in your community. It has impacted every single one of us, and there is a real need for healing and grieving. And so we have allocated, the Provincial Treasury has assisted us and allocated further funds to that. At the moment, we're running a program that is going out to 43 of our facilities, and between 150 and 200 people per facility in the first round are being able to participate in this particular program. Then the vaccine program. Now, this 150 million rand is the provincial contribution to the vaccine program. I will talk later on about 306 million rand. The 306 million rand includes the 156 million rand that we've got from the conditional grants. How we've allocated that out, we've allocated that basically 91. There's a national costing model that has been developed with National Treasury and National Health, upon which they allocate the funds. We have simply applied the same principles that were applied at a national level into the way that we have allocated the funding. The reality might be something different, and that is what we will have a look at in other adjustment budgets. And also, there is a substantial amount of money, about 800 million rand, that the Provincial Treasury is holding in reserve, which, when we start receiving additional vaccines, will be voted or allocated to the department so that we can upscale our vaccine program with the requisite funding. But basically, there is 91% of the money goes to compensation. There's about 9% that goes to primarily PPE, medical waste disposal, as well as the syringes and the needles. And then there is an amount that is set aside for vaccines and the procurement thereof at a later stage. So that gives us around about 2.1 billion rand in terms of earmarked allocations. Just to remind everybody that we are, and I guess Member Botha, this frames part of the question that you asked. We've got to provide services to 75% of the population of 7 million people. It's a constitutional mandate to progressively realize the right to healthcare, and we remain committed to ensure that the provincial health system delivers the highest quality to all people of the province. That is our commitment. Just to remind everybody that all the numbers then break in and are allocated to specific service points. So we've got 591 service points across the department, which is 467 primary healthcare service points, 53 hospitals, 49 EMS stations. We have 33 district, 5 regional, 2 central, 1 tertiary, and 12 specialized hospitals. We also have 49 EMS stations and 16 forensic pathology facilities. So that is where the large majority of our funds go. So I want to talk very briefly here about the budget process and the construction of the budget allocations. So the budget is divided between programs and facilities, and these are the principles and the assumptions that we have applied in the distribution of the funding. The first is the baseline. So where do we start from? Where do we strip everything out from? And that was the original 2020-21 budget, less the improvement in conditions of service. And that reduction was used as the baseline budget rather than the actual or projected expenditure because of the impacts of COVID. Compensation of employees, which is the largest component of our budget. There has been no provision made for salary adjustments. This is in line with the directives that have come out across the country from the National Treasury and in terms of the national budget. However, there are some small adjustments which are for pay progression, 0.4%, housing allowance 4.2%, and medical aid at 6.2%. So that's why you will see a small increase in compensation, but that isn't about employing or expanding service above our current baseline, with the exception of the people that we have on contract to assist us with the COVID response. Goods and services. At one stage, before the province was able to assist the department and provide us with an additional allocation of equitable share, we were looking at not being able to have any inflators for goods and services. And I think, Minister Botha, this is kind of part of the realities that we have to, Member Botha, this is part of the realities that we have to look at in terms of your question, because about 6 weeks ago, we were staring down the real possibility of having a 0% inflator in our goods and services and capital. We have applied a 3.3% to non-clinical goods and services, which is 0.9% below what Treasury had put out in their budget circulars. But unfortunately, our budget allocation wasn't sufficient to be able to cover that. So we went in with the CPI numbers that were reflecting, I think it was at the end of January. And then we do push a little bit of a higher inflator. We will always say that medical inflation for goods and services is generally 2% above the CPI. So we put in a 5.3% growth for clinical goods and services. Service expansions. I want to just clarify what this means. So it says no allowance has been made for new facilities, increases of services, or increased patient numbers other than the expansion of capacity of the observatory forensic services facility. So that it doesn't mean that we are not doing capital replacement and repairs of facilities. But what it does mean is we're not expanding any of our services beyond the forensic pathology unit, which is being built and will be completed in the very near term. And we've allocated 18 million rand to operationalize that particular facility. And then capital, we put in an inflator for the finance leases, so the vehicles, the EMS fleet, as well as the transport fleet. And then we didn't increase the budgets for machinery and equipment beyond what was allocated in terms of some of the grants that was given to us. So it's a fixed amount. Machinery and equipment is basically retrofitted into the budget that is allocated. There are needs, and there is an equipment committee that sits and allocates the budget based on the equipment needs. So these are just a couple of external events and activities that are very relevant to the budget decision. So Minister Mbombo indicated that the conditional grants, particularly the NTSG and particularly the Human Resources and Training grant, what they did is they applied a very high percentage cut. It was 8.4%. Sorry, it was 8.4%, which was supposed to incorporate the compensation cut of 5%. Unfortunately, our grants, so particularly the Human Resources and Training grant, is all compensation related because it's for the training of registrars and many other cadres of professionals. And we were staring down the reality of possibly having to cut that program in terms of warm bodies, physical people that we were employing or we were funding. And our provincial treasury came and assisted the department by making good on some of those shortfalls. Own revenue, I've indicated that there is still significant uncertainty. This is, you'll see even in the private sector that the revenues are significantly down. The simple fact of the matter is people are not coming in for surgeries if they can avoid those because of COVID. We've spoken here, I talk about the COVID-19 vaccine program, as well as the ongoing COVID pandemic. So I've spoken at length about this. The exchange rate is always a significant factor in the department. The large majority of our capital items are imported, and the majority of the raw materials that go into our medicines, as well as our implants, etc., are imported and are therefore at the vagaries of the rand. And then the population growth, the reality is that our demand for services continually grows with the inward migration, and our inflator is not keeping up with that growth. So therefore, there are more people coming into the province demanding and needing service, while we have a real decrease in the budget that is being allocated to us to be able to render those particular services. And it is going to get more difficult in the mid and the outer years, as I indicated earlier. So just a quick concluding remarks. The COVID-19 pandemic has had a profound impact on the demand for healthcare and how we deliver health services, as we need to minimize the risk of virus transmission to protect both users of the service and our employees. In the coming year, we are embarking on the largest vaccination program in the history of the country. There are about 5.1 million people in the province that need to be vaccinated. We are also most likely to face a third and possible fourth wave of the pandemic, and this, coupled with the existing quadruple burden of disease, is going to place significant strain on the health system in the coming year. Thank you very much, Chairperson. I end there.
Thank you very much, Mr. K. Mr. K, thank you so much. Members, can we then now also agree that we table the budget at this point? Taking members through the various pages from page 221 to page 258, of which members can then collectively ask their questions on the presentation, as well as the budget tabled. Members, page 221 to 230. Can you kindly indicate? We'll just have to give me an indication, since I cannot see your hands, members.
From page 221 to
230. 230.
I'm raising my hand also, Chair.
Okay, member Baku Fos, I recognize you. Any other member?
Was first me, Chair.
Member Van Vogel, is that you?
Yes, Chairperson.
Thank you.
I raised my hand, but I understand you can't see on the system.
Unfortunately not, yes, member, but you are recognized after member Baku Fos. Any other member?
Member Keko.
Thank you, member Keko. Any other member? In that order, please, members. Member Baku Fos, please proceed. Member Baku Fos. Members, and once posing your questions referring to either the presentation or to which page from 221 to 230, please. It seems like member Baku Fos may be experiencing some technical difficulties. If ICT can kindly assist. Member Van Vogel, let's go over to you.
Thank you, Chairperson. Chairperson.
Can you hear me, Chair? Oh.
Chairperson. Oh.
Member Van Vogel, you can proceed. Member Baku Fos. We'll just give you an opportunity after member Van Vogel. Please proceed.
Thank you, Chairperson. Chairperson, mine is on page 223 in the blue book. The Mr. K touched on this COVID-19 and vaccine. With regards to the 832 million, I was not clear because there was a disconnection, and then Dr. Keith Kluti assisted there, but I was not clear. I need clarity there with regards to the 832 million to fund COVID-19 activities. Can we get an overview of what this will be spent on? And do we still have enough PPPs in stock? And are there stricter measures to ensure prioritization of BBEE compliance companies in procurement? And is there any amount that will go towards danger allowance for health care workers? Then what is the detailed update regarding the Western Cape vaccine procurement process? And how far are we? And how many doses are aiming to secure, and which companies are being engaged? Lastly, Chair, what are the details of the team that is working on the vaccine procurement? And then actually, my last question, Chairperson, is on page 2 to 3, population growth. Given the population growth which will impact on service pressure, why is there no allowance made for new facilities? Increased services or increased patient numbers? Where does the fact that no allowance is made for new facilities put the rebuilding of the GF Jooster Hospital? Thank you, Chair.
Thank you very much, Member Van Vogel. Member Baku Vos.
Thank you, Chair. I'm in page 225. My question is as follows. Given the fact that no provision is made for salary adjustment, what is the impact of this and risk associated with it? And is there a budget set aside for any eventualities amidst the ongoing public sector wage negotiations? Sorry about that. That's my first question, Chair. And the second question is on page 224 in the COVID-19 response.
Member Baku Vos, we lost you there.
Can you hear me?
Very vaguely, member.
I want to know if this budget makes provision for expanded testing capacity, and when is the province going to expand its testing to include youth and other groups?
Member Baku Vos, can I just ask you please kindly to just repeat your last question, because we lost you there in the beginning of the question.
It's on 224, Chair. I want to know does this budget make provision for expanded testing capacity? When is the province going to expand its testing to include youth and other groups at risk? That's my second question, Chair.
Conclude, member.
Thank you, Chair.
Thank you very much,
and
member.
The last question.
Please proceed, member, with your last question. We unfortunately lost you again, member Baku Vos. We'll hopefully come back to you. Member Tego.
Okay. No, thanks, Chair. Mine is very brief. It's on the issue of the brief summary that was given. I think it's page 223, where it talks to the infrastructure provision of 1.1 billion. I just wanted to check if it's in line with the issue of the infrastructure allocation. it would talk to the issue of upgrading the current capacity of clinics, especially day hospitals, to be able to assist with the health facilities that are struggling, especially in the rural areas. Does that talk to that? And then also, lastly, to comment on the issue of the maintenance of health, HIV and AIDS allocation, which gradually increases from year to year, which means therefore that the department prioritized or did not budge on the issue of the decrease that we have seen on the budget itself when it comes to HIV and AIDS. Thanks very much, Chair.
Thank you, Member Tejo. Are there any other member on what was presented as well as pages 221 to 230?
I'm there, Chairperson.
Your last question, member. Please proceed.
Last question is still on page 224. I want to know when do we strike a balance between saving lives and rebuilding the economy? I'm asking this question because of the sometimes reckless calls made by the provincial government, such as reopening of borders and lifting ban on sale of alcohol, despite obvious risk associated with it. Thank you, Chair.
Thank you, Member Baku Force. Any other member?
Chairperson, my hand was up. Ricardo Mackenzie.
Please proceed, Member Mackenzie.
Thank you, Chairperson. So I had to leave for a few minutes just to take an urgent call. Chair, my question will just be on the health and training decrease. The item was from 636 to 529 million for training and development. I just want to ask, what would the impact be? Because obviously there's a risk for future services if our nurses and our doctors or any specialists or anyone that normally undergoes training and development is not trained. And I understand what has happened, and we know that the political implications of the budget cuts and where we are in this country. But what would the impact be on future services? And also, is there a risk on liabilities if, just an argument's sake, in 3 years' time or 2.5 years' time, somebody was supposed to undertake a course, a specialist, the department had to cut training and development, and that person, it's just an example that I'm making, had to go under operation and the specialist wasn't trained. I mean, obviously there's a massive risk to the department having staff that trained. Is that what I'm trying to get at? Is that sort of where we're cutting on training and development, courses for training that can professionalize more some of our services, and does it have a potential to put this government at risk for future potential lawsuits? And then on the vaccines, all my questions has been asked. Thank you, Chair.
Thank you very much, Member Mackenzie. Any other member? Not. Please allow me, members, just to pose my question with regards to the procurement of additional vaccines. I'm referring to the presentation now. If my sums add up or my information is correct, it's 75 million. I wish to ask that what role does the department play with regards to the procurement process, as well as to under which program does this earmarked allocation fall? And if I can just perhaps add up to that, is the department at this stage in a position that they could provide details of the vaccine at this point? I'm going down the line now in terms of responding to the members. I will start with the Minister, HOD, and then Mr. K, or the HOD can then indicate who from the department will respond. Minister Mbombo, is there anything from your side that you wish to respond to?
Thank you, Chair. I'm just going to respond under general. Then the department can be able to fit in some of the missing pieces. You need to understand that in the allocation for COVID, we have got the money that 800 plus, which is for the overall COVID response, whether it's about the testing, it's about the quarantine, isolation, whether it's about at the hospital level. It's a whole package of the different activities.
Excuse me, Minister. My apologies. Member Windvogel.
Okay. So it's a whole package of currently like we are responding to it. So take into consideration the possibility of the third wave. And then you have...
Chairperson, no, I can't hear the minister.
Member Windvogel, can you kindly check your connection because I can hear the minister quite clear. Is there any other member that are experiencing difficulties?
No, Chairperson, I can hear the minister quite clear.
Will you kindly check your connection, Member Windvogel? Can I also ask ICT to kindly assist Member Windvogel? Thank you.
Or to up the volume in their device as well. Sometimes it's like that. And then you have the 300 and something that is related to the rollout of the vaccine. And then you have the 75 million for the purchasing, for the procurement of the vaccines. So you need to understand in terms of what takes place. And it links up also to the question by a member, Tlhako, talking about the HIV/AIDS. You'll find that that is the grant, by the way, that is coming from the national. When they increase the HIV grants, it's not about to focus on the HIV. You can see that the sub bullets from that HIV, it includes from the Presidential Employee Initiative, Community Outreach, TB, HPV, COVID-19. The COVID-19 there, it's about 156 that they've allocated. And then there's also mental health. So it's a whole package. So what they do, which they did even in the previous budget here, when they were saying they're giving us money for COVID, what they did, they just increase the HIV grants budget. But the problem, it's about, it had limitation where you cannot use much of that money for the other stuff, just compared to, like, for example, infrastructure and all of those. So that the members can be able to understand. So similar with the issue, again to respond to the issue of the vaccine, as we have indicated then, the response is about, at this stage in South Africa, there is no confirmation of the approval of any vaccine except for J&J, which is still part of the implementation study. So that we are providing tools and also sharpening the axe so that when there is a time that we have to procure, because once they have approved, it will make it anyone to be able to purchase. Anyone, whether it's a private, whether it's an individual, one could be able to procure vaccines. So that's why we have put all of these in place, so that at the time that we could be able to, we can be able to procure. One of the interventions that we have made is about where we have that template letter, where anyone who says, oh, I'm distributing, or I'm selling vaccines and whatever, all of those, we just provide them with a letter. Where that letter does, the service provider needs to fill in. It talks about whether those vaccines that you are selling have been approved, the SAPRA, and whether they are also responsive to the vaccine, to the variant, and some questions related to the issue of the what we'll call the indemnity, especially for when there are issues related to the faults and whatever, all of those. So we're already doing that. Same applies. We've already even approached the Pfizer and the J&J if they want probably to sell to the province. They said, no, we want to engage with the national. So we're putting things in place so that at the time that we have to do such, we could be able to do. So we don't have the details about what are the companies and what, as I've just mentioned now, the ones that we've already approached. Others, as is always the case, even during the time of the PPE, where every Jack and Jill will say, Minister, whoever, I've got this company, whether it's coming from China, whatever, or I can be able to distribute whatever. That's why I say that this is the process that needs to be followed. Similar now, even with the vaccines, they're asking the same thing. Any Jack and Jill approach, similar where people say Jack and Jill for the waste management, I've got this company. It's a similar process. So you mustn't be like take as if it's something that's the procurement of the vaccine. It's something that is there in the dark and whatever, because it's not against the law for the province or anyone to procure the vaccine. It's the choice of that service provider or of that, whether it's us province or it's private or it's a GP not to procure because of the uncertainties, as we indicated, we have been saying before. What if there could be another variant where we find that the current vaccines might not be responding to? What if there might be some of the adverse events, outcomes, where we find that they might be quite too much for the province or any other to be able to endure? Currently, the Department of Health does take a responsibility in regard to the indemnity and all of those. So for us, at what extent? Then when we procure, and then we have to make up, work out the matters related to the liability and the indemnity. So this is about this uncertainty, but it doesn't mean that we haven't put the processes in place. In regard to, so in terms who's the team and whatever, it's the same team, same team that is involved in the procurement of the PPE, same team with the procurement of Panados or whatever, all of those. It's the same team. You work with a treasurer. Each and everyone, according to the PFMA, has got a responsibility in regard to the procurement, the whole of the SCM chain. So there's nothing untoward about all of this, because we mustn't create that kind of uncertainties, or it's a procurement of a vaccine. It's something, whatever, that is not part of the processes. But the reason for that you'll find that you will not be able to proceed is because of the whole issue about the approval by the SAPRA and all of this that I've just mentioned. In terms of the JOST and others, I think Mr. K did present in regard to, whilst we might not be able to pursue new facilities, which is where one wakes up and then dream about having a new facility. The ones that have already been planned in the process, whether it's a new clinic like a new clinic in Avian Park or a new extended clinic in Parks, Parkerstop and whatever, of those, they're still going to continue. And at the time when I'm delivering the budget speech, you'll be able to see in terms of which one of those. But at the back of the of your documentation, you can see under infrastructure, which each infrastructure, where they are and how much has been allocated. So with the JOST, they will find that there, and also Tigerberg Regional Hospital in Bella, you find in the Stellenbosch arterial, you'll find that they do indicate in terms of how much we have received in regard to that space, and also how much we contribute. But as you might have seen, that is all in regard to, still at the early phases in regard to the business case. So it's already been there, but of course, you'll have to plan accordingly, as I indicated earlier. In this MTEF, the health sector budget is decreasing. Like I'm just looking now for 2023, 2024, the equitable shade shows about 19.4 billion, whereas now in 2021, 2022, it is about 18.9 billion. And with all these grants that are decreasing, the uncertainties in terms of dreaming big. So we have to make sure that we deliver what we need to deliver. In regard to testing capacity to include all of those, again, remember the testing is part of National Health Laboratory Services, which is a competence of the National Department of Health. And then for us, meaning our role is about whatever interventions we do, it must be able to deliver. So the testing, there are two things. It's about the scientific evidence. It's also about the resources. So making an example, when we started to change we have a differentiated strategy or approach in regard to the testing in the first wave, it was in the space of where people have to wait for longer to get their results back. even up to 2 weeks. And then by the time you get the results after 14 days, actually supposed to be out of the quarantine stage or even isolation. So we have to approach that. So it's based on the resources at the time. And secondly, it's scientific evidence. When there's a high level of the local transmission, that is already, community transmission that is already there, it means that the default position is about where you find that people they could be positive, as we have seen with the serology, which is the blood testing of the antibodies, what we did. Meaning now you have to focus and prioritize those are vulnerable. You want as many people who are vulnerable so that you can have a prompt intervention to prevent the severity of the impact of the COVID to those people, and also to hospitalize them if need be. For example, those with diabetes and those who are older. So it's about where you open up, because it's all about the issue of the equity. Testing for a 24-year-old, go and test for a 24-year-old with no symptoms, who's not ill, vis-a-vis, compared to where you want to channel those resources to test for that 60-year-old who might have COVID, comorbidities or not, but you know that is a high risk. So it doesn't mean that you still going to use the same resources, but we have to make the point that you open up for those people that needs to be protected by us in regard to the health system. So you have to weigh the balance. So why would you want to test that 18-year-old? Because I don't have symptoms, I've got nothing, but I feel like I want to test. I want to know my status. So it's not like about HIV where you knowing your status. It's quite important as, for example, for now, it's about whether you could be able to, if you have got illnesses, it could be prevented. Or that's why by default position, we say protect the vulnerables. If you are young and wherever you are at a home, you're staying at home with parents who are older, whoever, protect them, make it a point that you, as I indicated, that you apply the NPIs. And then with regard to, I think the other department can be able to respond to that. But generally, with the public sector wage member, Force, you may recall, again, I'm responding general. You may recall that the unions did negotiate for 3-year wage increase with the national as part of the bargaining council, which is at the time there was an agreement with the not National Department of Health, but across, because it's all public services. So they agreed to that. I think the national minister then was Mama Faith Mutambi on the Public Service Administration. So there was that agreement. Up to the time when the national finance minister said that the country cannot afford this automatic kind of the wage increase, up to where he stopped it, Minister Tito Mboweni, he stopped that. And the unions took the national to court in regard to for this agreement, which is at the time before it went to court, we still have to ring fence these monies, because even then when there was a blanket increase, we did indicate that because there's no additional new money that comes to the provinces, it means that we have to absorb all of those. It's not only about the wages only, but remember, it also includes about contributing to the medical aid, housing, and the whole kind of the package. So we have to ring-fence that money in case now we have to make these increase to the salaries. And then the court came back, they said that no, the National Minister of Finance is right. There was no need to have this 3-year blind increase throughout. But it is, I think it's going to Constitutional Court. I'm not sure whether it is back yet, but we're given the information that, okay, we can be able, because now the National Department, National Treasury, won in that first leg about it. So the whole about the public sector wage, it is about what is happening at the national level. And then it impacts on the provinces in regard to how we do some of this budgeting. I think the Department HOD or Mr. K can respond to the other. Thank you.
Thank you, Minister, for your extensive answering of those questions. HOD.
Thank you, Chairperson. So the Minister's covered most of it. So I'm just going to touch on a few and then ask Mr. K just to do 1 or 2 specifics. So just in terms of the last issue, the salary adjustment, the question was whether we've made any provision for anything. What we see in our budget is on the assumption there is no increase for salaries. So our budget does not have money for salaries just in case the court decides against that. If the court does decide that there needs to be an increase in salaries, that needs to be discussed with National Treasury and with the country and all the public sector in the whole country. So we do not have money set aside. The assumption in our budget is the salary increases will not happen. The second thing is, what is the risk of that? We are talking with organized labor, so this is not featured on our radar. We have a very good relationship with organized labor in our province, but obviously, as the minister said, if there is a national process and national organized labor takes a decision, we then have to see what the impact will be in our setting. When it comes to the COVID testing, I just want to clarify, in addition to what the minister said, we must be very clear that we have waves, and testing is adjusted as we move from different parts in the waves. So when we get to a peak of a wave, we announce that we restrict access to testing for the reasons the minister gives. And that is, when you get into a peak, you have possibly so many people infected. You then decide what is the best way to use your limited testing capacity, and you restrict it to people that's most at risk or people in hospitals so that you can improve the management of the cases. That's a specific time when we take that decision. When we come out of a wave, where we are now, we make a decision that testing is available for everyone, because in the time where we find now between peaks, we want to pick up anybody with symptoms to pick up cases. So when the member asks, when are we going to open the restriction? We've opened that like 6 weeks ago already. Everybody with symptoms is currently being tested. But when we go up the wave again and we get to a peak where there's so much infection around that we have to limit it again, we only limit it for that period for the management of cases. So that's when I explained that that's the waves that we take in terms, and we have an expert testing committee that adjusts our criteria and our testing all the time. But if you go now to anybody with symptoms, young, whoever they are, they're all free to be tested as we speak. Just in terms of livelihoods and lives and livelihoods, I think it's an important thing as a health sector. We're very much part of the bigger society. We ourselves say we understand the impact of lockdowns. We understand the impact of restrictions. We understand the impact on the economy. If the economy does not take off and there's less money in the system, you see the health system will have as big an impact, if not bigger impact. So it is in our interest to make sure that we balance the lives versus livelihood debate so that the economy does not take such a bad turn for the worse, because we are going to be the ones that's going to have to deal with the results of the poor economy. So we don't take these decisions lightly. We put our position forward. When we came to December, we had very clear in this province that we made a call for the restriction of alcohol. We made a call for the restriction of movement. And this province approached the National Command Council actually to do that from the 28th of December, because it was needed at that time. As we open the restrictions, it's important for us to get a constant balance between lives and livelihoods, and not to say it's one or the other. We need to find a way of dealing with it. And that's a global challenge. It's not just a Western Cape challenge. I think the issue about the 300 million, I'm going to ask Mr. K to just give that again, the 832. But the minister is right. The 832 is for the COVID response. And we have 3 things that we fund from that. Mr. K will tell you exactly what those 3 things are in 3 amounts for that. But when it comes to the vaccines is the additional 300 million. 150 out of the National Conditional Grant and 150 out of the earmark money in this province. And the minister has been very clear. There's only 2 things we've done so far. We have written to companies that can provide, that's Johnson & Johnson and Pfizer. They've both told us they are going to provide through the national process, not directly to us at this point. Anybody else that says that they've got potential vaccines, we've gone through a normal, straightforward supply chain process for unsolicited bids. We ask every single person to say, provide us the details of the vaccine. Where is it? Is it registered with SAPRA? Is it effective against our variant? Who's the suppliers? Can you do this? That's the standard process. And the team is our pharmaceutical team in our department, and they work closely with the treasury team in relation to that. Then in terms of the new facilities, Minister Mbombo touched on it. There is money in this financial year as part of the money that we have to start the planning for the Klipfontein Regional Hospital, as well as for the Belhar, which is the Tygerberg Regional Hospital. That means the money has been made aside, the business case has been signed, the money is signed, and we need to start the planning this year. So we're working with Public Works to start the process for those two hospitals, which is very important, and it is proceeding in this coming year. I think Member Tejo has been answered in terms of there's quite a lot of pictures at the end of the report. You can see in the annexures, and you can see every single facility that is being that will be getting upgrading during the year, and it's a clear breakdown between rural, metro, primary care hospitals, and that money does include those things. I think the point on HIV/TB, we share Member Tejo's concern because, and we have tried to maintain our response to HIV/TB within the broader context of all the other sub-programs. So TB and HIV is an important consideration for us. We do not want to lose the gains, and we're working with all our colleagues to do that. Then I think Member Mackenzie's question about the impact of the training and development conditional grant reduction. I think I just wanted to make this clear to Member Mackenzie. In this province, that money has been allocated to warm bodies. That is specialists and registrars in training to become specialists across our different hospitals. So if there's a reduction, one of the risks was we actually physically have to take, say, a surgeon in training and say, we don't have money, and we now reduce the number of surgeons in training, therefore there will be fewer surgeons available in 2 years' time. Or we take a specialist out that's currently doing service and doing training, then we reduce the service and the training capability in the system. So the point is, out of the equitable share allocation and the provincial allocation, we've been able to soften that, Member Mackenzie. So we've compensated from the additional money to offset the money that's been reduced from the National Conditional Grant. Me and Mr. K will definitely be taking this up with the National DG and with our colleagues at National to actually talk through with them the implications of the conditional grant reduction for national tertiary services and for training, because it threatens the services that's rendered at Grootskep, Tygerberg and Redcross and our specialist services in this province. And then the last question, I think is covered, Member Philander, in terms of the vaccines. So I'm going to ask Mr. K just to quickly just go back over the 832 because he was interrupted, and just say what the three components is and exactly how that money is made up. Thank you,
Absolutely. Thank you, HOD. Mr. K.
Thank you, Chairperson. So the 832 million is broken up into three major components. The first is 250 million rand for testing and surveillance. That will be a mix between PCR testing as well as antigen testing. There is a fairly substantial difference in pricing that comes through, which then impacts and allows us to move the testing policy forward. There is 250 million rand that is allocated to PPE. There were some specific questions that Member Windvogel asked around the PPE. So I will say that our PPE procurement has been audited twice by the Auditor General and reported as being compliant. There are no major issues that they have discovered within our PPE procurement, and that has been reported on twice. We have got we are blessed with the ability to do some assessments on quality, and where PPE is delivered that does not meet the quality, it is sent back to the supplier.
Mr. K, it seems that we have lost you again.
Sorry. I will have to stand in for Mr. K again. Sorry about that, Member Windvogel. The last time I did it, I didn't provide clarity, so I apologize. So the 250.
No, I'm back. I'm going to turn off my camera, if I may.
Thank you, Mr. K. Please proceed.
So I was saying that includes what's been coming in terms of some of the donations. We found some of the donations to have been substandard, and so we've got checks and balances to ensure that the donations are that we only accept compliant donations. When it comes to the danger allowance, it's same as the issue on the increases. We fall into line with what is negotiated at a national level, because once something is negotiated with the national level, then the national treasuries are required to provide the funding that then filters down into the various departments to comply with the things like danger allowance and ICS. So I think, then the last matter is we've allocated 332 million rand towards sustaining the hospital platform. So we've allocated 175 million rand to Brackengate, and that allows us to keep Brackengate open for an average of it's about 112 beds over the whole year. But obviously that's how we've allocated the money. We expect there will be peaks and troughs where at the moment I think there are less than 15 patients currently in Brackengate, and we hope that will stay that way for a long time. But if it does uptick, we've provided the budget to allow for scaling. And the same thing happens in Sonstraal, although Sonstraal slightly less money because they've already got in-house resources allocated, but we've done the same principle and allocated 19 million rand to Sonstraal. Sonstraal acts as the buffer for the rural, primarily the two regional hospitals being Paarl and Worcester. They're able to feed patients into Sonstraal. The remaining money has been allocated across the platform based on the number of additional employees that we have contracted, or a number of people that we have contracted across the whole of the whole platform. The rationale is quite simple. It makes no sense for us to have gone through all the effort now to recruit people for a 3-month period, to then let them their contracts lapse, and then when we have a next wave, then we have to go and re-employ people. The simple fact of the matter is the single biggest impact, I guess, is people and being able to treat those that are infected with COVID. So that's the principle that we've applied, and the money that we got basically gave us the flexibility to extend those contracts up to the end of September. And as I said, there is additional funding that is still available at a central level, which we would probably have to access at some stage. Hopefully it will just be for the vaccination program, but if there are specific needs, then we will have conversations later on in the year. But that's how it's been allocated now. And then the last question, Chairperson, you asked around some calculations. So let me just explain to you. There is 79 million rand for the equitable share vaccine sitting in program 1. That is basically the 75 million rand, which is the budget that has been allocated for procurement. So I just want to clarify that as well. We cannot enter into any contract or any agreement with anybody to purchase anything without a budget. And therefore, a budget has been provided should the opportunity arise that one of the approved pharmaceutical or approved vaccine manufacturers is then willing to start dealing with subnational governments. We then have a head start because we have got money against which we can then place orders in the future. The remaining 71 million rand is put in program 2, and that is primarily for the funding of the compensation element. So we are looking, and we have trained already around about 2,000 vaccinators, and we are going to need to train significantly more. We have already put out, there is a volunteer system, there is a portal that people are able to apply to become vaccinators, and there is also money that is needed. Vaccination requires basically a one administrator per vaccinator to make the system work efficiently, and so that there is money that is allocated in that particular spot to fund those particular issues. I think I've covered. Just on the population growth. So you asked also, Member Botha. I've got Minister on the brain. My apologies, Chairperson. And also Member Windvogel asked about how do we deal with population growth, and innovation. So you will see that we've been given 199 million rand over MTF for chronic medicine distribution. The province is investing in that because it is much cheaper per patient to take the medicine to the person's house than for the person to come into the facility and wait to be served. So you can do, because your cost per package is significantly less than having the person and looking at the operating cost of them having to come in to the facility. So those are the kind of innovations that have to happen. You would note that there is a 5 million rand allocation, not next year, in the following year, for telehealth and telemedicine. The future of health services is around the utilization of technology and not having to have people come into facilities unless it's absolutely necessary, and to be able to monitor health outcomes and individuals outside of the traditional bricks and mortar through technology. And that's where we're going to have to move to, and that's where the investments are happening. We have gained enormous insight into the use and of data, particularly within our COVID response, and the fact that we have invested heavily in our data center. That investment will continue, and the lessons that we have learned around managing the pandemic and being able to focus resources based on the information, the data that we have collected, that will be expanded to other services and other programs within the organization. That's where we're going to move towards. Thank you very much, Chairperson.
Thank you very much, Mr. Kay. Members, that concludes pages 221 to 230. We are 2 hours down the line. I would at this point request that we take a 10-minute comfort break and be back at 10:15. Thank you, members. Members, it is 10:15 according to my watch. We are back. Members, we will now swiftly move on to pages 231 to 240. I am able now, due to the assistance, thank you very much, Siraj, to recognize you by the show of hands. So you are now more than welcome to indicate so on the pages as indicated. Members?
Member Barnes, Chair.
You may raise your hand now, member. I will be able to see your hand. I recognize you, Member Barnes. Any other member?
Thank you, Chairperson, for the opportunity. I'm just not sure I missed out where you said where we must stop. 2382, 240.
231 to 240.
Okay. My question, I then have just one.
Just one moment, please. After Member Barnes, it will be Member Mackenzie. Any other members? Not? Please proceed, Member Barnes.
Thank you very much, Chair. Let me take over where Mr. K left off on page 238 on the earmark priority allocation, home delivery of chronic medication for 33 million. What I want to know, is this outsourced? If so, what are the details of the suppliers? That's my only question for now. Thank you, Chairperson.
Thank you, Member Barnes. Member Mackenzie.
Thank you, Chairperson. Yes, on that, on the question that Member Barnes asked, I actually wanted to ask on that as well. What is the communication strategy? And because we saw, I think it was additional 90 million that was allocated, so that the communities know what's happening. If we can just get an idea, what's the communication strategy to inform people about the service, and when would we be able, and Chair, perhaps a question for you, we'd like you to get a presentation on the rollout of this, something that we can make a recommendation on. And then Chair, I'd just like to make a comment on the first question I asked earlier, and I'm happy that Dr. Kluter is taking that matter on training and development up with the National Department, because it is a concern. For me, and I know it's not the Western Cape government is not to blame, because we're going to see it in 2 or 3 years' time, and not now. Because one of the things he mentioned that some people had to be taken out of training, if I heard that correctly, and I just wanted clarity on that, because that is actually a bigger concern if some specialists had to be taken out of or stop being trained, because that's going to have a massive impact in the future. Thank you.
Thank you, Member Mackenzie. I will allow the HOD and Mr. K. Please proceed.
Thank you, Chairperson. So I'm going to ask Mr. K just to give the details of the home delivery medicine system in terms of what the money is for. But just in principle, what we've done at the beginning is we very much ran this program as external resources that parties brought to the party, and we worked with an external provided donation to our department as the medicine delivery system. This, what you see the money for now, is when we're starting to institutionalize the system. And there are 3 or 4 options of what we're going to do, and you will explain exactly what the money is for. It's now taking an innovation program, which was externally funded. We're providing internal funding to institutionalize it. And then we will explain what exactly the money is for in relation to providers and the communication and the process around it. Just to clarify for Member Mackenzie, Member Mackenzie, we did not take any specialists out of training, and we did not actually take any registrars out of training. We say the implications, if we had to visit that budget without that cut, without bringing our additional resources in. So what we did is we compensated for the decrease by bringing our additional resources in to prevent us from losing specialists in training or specialists. I just want to clarify that that's the situation. So we didn't take anybody out of training. We didn't take any specialists. And when Mr. K says we have additional money from the provincial treasury to help us not to reduce our approved post list, that's what it means. It's compensating for that decrease in terms of preventing us losing any staff. Mr. K, over to you.
Thanks, Dr. Kluti. Let me turn off my camera because I've had problems beforehand. So the answer on the chronic medicine is we will go out to tender for the service. Dr. Kluti has covered very much that this was a donated service over COVID, so it didn't cost the fiscus any money. But obviously, once one is voted money for a particular service, the compliance matters and aspects that come in from an SCM perspective are they need to be complied with. So that will be done. It's primarily been done in the metro area because of the distances that are involved. However, there is interest, and the rural team will be involved. We'll have to map out exactly what their involvement is, and from there, the communication strategy will then follow about who is going to be targeted, how they're going to be targeted, and the methods of delivery, and ultimately the service providers that will provide that delivery service. I just wanted to say also to on Member Mackenzie, you must remember that the Western Cape province provides training for much more than just the province. We are a national centre of training, and that's why we funded, because conditional grants are ostensibly national mandated amounts that come through for the benefit of generally not only the province but as the country as a whole. And that's why Dr. Kluti and I need to go and have some further and deeper conversations with the Director General in terms of the impact that this has on the country's ability to train. What's also included there is a separate component is the statutory employees, or the statutory posts, sorry. And those are the interns, the medical interns. There has been significant pressure that has come into the whole country because of the returning Cuban program. The Cuban students have been coming in. And we as a province have been unable to absorb additional students because of the funding envelope that we've got. So our main goal is to make sure that we match the number of people, the number of people that we are training with the amount of money that we are ultimately getting. So I hope that just clarifies the national view a little bit. Thank you, Chairperson.
Thank you very much, Mr. K. To you. Members, are there any follow-ups with respect to the responses? I recognize Member Mackenzie and then Member Barnes.
Thank you, Chair, and thank you for the clarification. Chairperson, just on the mobile services, and I heard from Mr. K that they're only starting with the tender process now. And I just wanted to get, because at times, not all times, our rural areas, and I mean, I just can't, for myself, think why, imagine the cost of delivering a pack of chronic medicine from Beaufort to Merivale, which is 130 kilometers. But I would like to ask that we do not ignore those small towns and the small areas for these mobile services. I can imagine it will be quite prohibitive, but I do think that sometimes, not all the times, that our metro tend to get more benefit out of these innovative than our rural areas. Thank you.
Thank you, Member Mackenzie. Member Barnes.
Thank you, Chairperson. I think Member Mackenzie and I are today on the same page, because my follow-up would have been exactly on the rural matter. However, now that I'm covered, my second question will be monitoring of the service providers that are being appointed. It's very close to my heart. Does the department have a way of monitoring these in fact, these suppliers that are appointed by them? How do they keep track if the job that they are appointed to do is accurate, and is it done correctly? So can I just get maybe a response on that? This one is very close to my heart as a rural person that has seen things happening. Thank you, Chair.
Thank you very much, Member Barnes. Response?
Thank you very much, Chairperson. I will respond. Thank you for Member Mackenzie and Member Barnes. Just to clarify to you, home delivery of medicines has been an innovation that has been done across the province. In the metro, it started with an external donation, and because of that external donation, we've been able to deliver more than 1.3 million parcels to people's homes. That does not stop. That external donation will come to an end, and this new money is about actually entering a tender process. And in the tender process, we will have all the specifications, which will include coverage for rural, coverage for metro, what will the provider do, how will we monitor it, how will we supervise it, all of those things will be included in the tender process. I understand from the context of Member Barnes, because I know what she's referring to, there's a distinction between what we put out on tender and how we specify how the service provider renders our service and how we monitor them, as opposed to when there is national providers that through national funding, like USAID funding, is also providing services in this province. And that is specifically the case that Member Barnes was referring to, that she's been in contact with the department over the last couple of weeks. For that purpose, we are not providing the money. It's a donation again from outside, but it is incumbent on us to be able to work with the parties to put strict systems in place for oversight in terms of A, the quality, B, how the service is done, and we are very much taking cognizance of all of those things. But when it comes to the home delivery of medicine, remember this is we're starting the process. What people have done in the rural areas is, for instance, in Essequa, the people that work outside Riversdale, the Essequa pharmacy, sub-district pharmacy, they pack their own little medicine parcels and they put it in the GG cars and deliver it to people's homes. They didn't wait for a program from the province and from the metro for them to do it. So it is not as if these practices are not already happening. What we're talking about here is money for an external tender, and we will then award it accordingly and monitor it accordingly in terms of the impact. Thank you very much, Chairperson.
Thank you very much, HOD. Members, can we conclude? I see a hand, or is that an old hand? Member Mackenzie?
Chairperson, just on this point, if I can just make one quick comment on this. One always appreciate what some of these people in the small towns are doing, because it's very difficult. And I saw in the budget vote yesterday that Minister Maine also allocated 2 million for supply development for small businesses. And I know that, for example, there's a guy delivering pizza in Kailicha, I think it's Kailicha Cycles or something like that. And I do hope that when this tender goes out, that one do take into account smaller businesses that knows the community, that operates in those communities, and that somehow there is a space in that for them to operate, and not just big corporates that will benefit from this. Thank you.
Thank you, Member Mackenzie, for that input. Member Van Vogel.
Chairperson, mine is one follow-up. GSA has been in the planning for several years, and now it's very difficult for me to understand this. We are saying we are taking the service to the people, but if you look at this, it's where we take the service away from the people and expect the poor people to pay taxi money that they don't have to go to clinic or hospital. So I'm not happy with the answer if it comes to the JF Jooster. Then on danger allowance, perhaps I missed that part, but I didn't get an answer on the dangers allowance. Thank you, Chair.
Thank you, Member Van Vogel. HOD.
Thank you very much, Chairperson, to Member Van Vogel. What we've been doing is that the planning for the Klipfontein Regional Hospital has commenced. We have confirmed that we will rebuild Klipfontein Regional Hospital. We are now in the stages of putting the plans together, getting everything together, and starting the process. It has taken time, but the process has started. And the money in this financial year is to start the process of the plans, to put it all together so that we can accelerate the delivery of the infrastructure for the Klipfontein Regional Hospital. In relation to danger pay, the answer is danger pay is a national chamber determined condition. In a province, we do not have the powers to separately negotiate danger pay for people outside a national chamber negotiated process. So when we say there is no money made available for salary increases, it is on the basis that there will not be a salary increase. And when we say that there is no money available for danger pay, it's on the basis that that is not being signed off in the national chamber process. Both of these, if there's to be a salary increase, if there is to be danger pay, it is nationally negotiated. And once it's nationally negotiated, the National Treasury must make provision for it. The budgets that we have do not make provision for increase in salary and do not make provision for danger pay. And neither do we as a province have any jurisdiction to negotiate that unilaterally in this province. Thank you, Chairperson.
Thank you very much, HOD. That does conclude pages 231 to 240. Members, we now divert to pages 241 to 250. Any questions from members? Show of hands. No member. Member Barnes. Please proceed, Member Barnes.
Thank you, Chairperson. I'm on page 250, sub-program 7.5, the medical depot management and supply of pharmaceuticals and medical supplies to health facilities. One, my question is, does the depot have enough capacity to handle the vaccine rollout? What are the challenges and how are they being addressed? When will the replacement of the current depot be finalized? And what is the total cost of this exercise, Chairperson? Lastly, why is the budget for the medical depot decreased as shown in table 8.7? Thank you, Chairperson.
Thank you very much, Member Barnes. Any other member? Not. Chairperson. Member Van Vogel, please proceed.
Chairperson, mine is on page 251, sub-program 7.3.
Can I just ask you, Member Van Vogel, to just hold back with 251? We are currently dealing with 241 to 250.
Okay, fine.
Thank you, Member. Thank you so much. Mr. K?
Thank you for the question. I will answer the capacity at the depot to the best of my ability. I will say the following, that what we've done in this last year is we have now moved the non-pharmaceutical, so the PPE and some other non-pharmaceutical consumables, and we have moved those out of the pharmaceutical depot, and we have put them into a warehouse which is under the control of the supply chain. So that is on the PPE, and I've articulated what we've been doing on that beforehand. In terms of the decrease in the budget, as I said, we must just be careful about what we're comparing what to. So that comparison in that table looks at the budget for the current year, and it looks and it compares it against the adjusted budget with COVID. And obviously there were significant additional expenditures that came into the depot, particularly in distribution of the COVID and PPE related matters that were still sitting there for this last year, and that's why we allocated them some further additional funding, and that's why you now see the slight decrease. Thank you, Chair.
Thank you, Mr. K. HOD, anything you would like to add on the first part?
Yes, yes, Chairperson, two things that I would like to add. the depot has sufficient capacity for the vaccines. We do flu vaccinations every year, and we do all childhood vaccinations every year. So the CMD, the Central Medical Depot, has definitely got the capacity to distribute vaccines. Where it becomes complicated is if the vaccine has got different cold chain requirements, which might be the case with Pfizer vaccines. And in that case, the CMD has already negotiated with Stellenbosch University that has storage facilities that can store vaccines at -70 degrees. So we have that storage capacity, but we will still be using the distribution network from the CMD. So it is sufficient. And then we do this all the time. And then there is this relocation of the CMD itself that in a sense, the process will also be sped up during this year, and we will have much clearer understanding of exactly what timeframes that would be. We don't have exact timeframes at this point in time. Thank you, Chairperson.
Thank you very much, Dr. Klute. Members, any other questions on the pages mentioned? Nothing, it seems. We conclude. We move on to page 251 to 258. Member Windvogel.
Chair, as mentioned, sub-program 7.3, do we have enough capacity in forensic pathology services and progress on the current projects? Thank you, Chairperson.
Thank you, Member Windvogel. Any other member? Not. Member Barnes, please proceed.
Chair, can you hear me?
Yes, we can hear you, member.
Okay. I'm on page 254. The changes in policy structures, services and establishment. What is the total cost of the 8 projects that will be constructed in handover stages? Can we be highlighted on that one? Thank you, Chair.
Thank you very much. Member Barnes, does that conclude this round? Members?
Yes, Chair.
Thank you very much. It seems I will ask now for the department's response.
Thank you, Chair.
Okay.
Sorry, Keith.
So I will maybe just respond to the forensic pathology capacity. It's fair to say that forensic pathology capacity has been under strain over the last few years. Specifically, the pressure has been felt quite significantly in both Metro West and Metro East. Metro West, it is the Salt River Mortuary. Metro West, Salt River Mortuary, and at Metro East, it's the Tygerberg Mortuary. So in both of those instances, we're bringing some capacity relief. You know that the Salt River Mortuary progress of project there is the bringing online of the new the Forensic Pathology Institute. And that is quite an exciting process. The building is nearing completion, and we will bringing that service online during this financial year. So that will bring relief to the Salt River Mortuary pressure or Metro West. In Tygerberg, we're also having smaller projects to actually increase the capacity at Tygerberg to help with the storage of body and the management of the pressures at the Tygerberg Institute. When it comes to the community health centers and the 5 projects in detail, I'll hand over to Mr. K, and he can decide whether Dr. Angeleti du Toit will handle some of that. Mr. K?
Thank you.
Thank you, Chair. Thank you, HOD. Yeah, I think there are a number of infrastructure-related questions that have come up, and I think it would be fair to allow the program manager to talk to some of those matters. So if I could ask Dr. Angeleti du Toit just to answer some of those questions. Thanks, Heath.
Thank you so much.
Thank you, Chair.
Good morning. Good morning, everybody. Good morning, member and chairperson and colleague. The question that I understand from page 254 is to give an idea of the costing of the project as far as I understood. And I was thinking that maybe it would be fair for me to compile a short notice and give you the information, because there is no point for me to give you the list and then more or less the cost. But what I want to mention as an important project over and above the forensic pathology that is going to be finished hopefully by the end of April is the Victoria Hospital new EC. The new EC is the new emergency center. Victoria Hospital has been quite busy during the second wave, and I want just to mention that we also currently we already replaced the bulk oxygen tank that is going to be much more, catering for the possible third wave. So this is something that we need to highlight. The program 8.5. The two projects that Groteschiera and Tageber are also completed soon by at the end of the month, and but I will give you the details of the costing in a separate memo. Thank you.
Thank you very much, Dr. Angeleti de Toy. HOD.
Yeah, thank you. I think Member Barnes was referring to 8.1 and talking about the 8 projects to be in construction and handover, of which those 3 was there, and Dr. Angeleti will cover that together with the other projects. Thank you very much.
Thank you very much. Members, are you covered? Are you covered, Member Barnes?
Chair, I think I'm going to welcome the separate memo that will be sent to us. However, I would just have loved to have an idea as to just a projection, how far or what it is. In depth, I can take later, but now I just wanted a simple projection. Thank you, Chair.
Dr. Angeleti de Toy, are you in a position?
Yes, thank you, Chairperson. Yes, I can. It's only for 8.1. I can tell you, Sandy Point is a satellite clinic and is currently on tender and is in the cost around about 7 million rand. Avian Park is currently started construction in just January. It is if I remember correctly, more or less 30. And Nyanga is also in construction at the moment, is pharmacy compliance and maintenance, and is I think is in the order of 10 million rand. Thank you. And the other ones I will give information.
Yes, thank you so much. We will welcome that information. Members, are there any other questions on pages 251 to 258 at this point? If not, members, we will then move on to the annexures, pages 259 to 269. No questions. 270 to 280. None, members. And then 281 to 294. That concludes vote 6. Being the last page with the annexures on 294. No, member? Thank you very much, members. I will at this point allow, is Ms. Kivitz still with us?
Yes, I am.
Thank you very much for availing yourself and being with us this morning, Ms. Kivitz. You are now welcome to make a submission on the budget or ask a question, and we will ask for a response accordingly. You may proceed, ma'am.
I only have one question, surprisingly, but yeah, only one question. On the staff wellness, are the department only looking to the frontline staff? Because in a conversation with staff, it seems as if those that are being affected by COVID are not really looked at. So that's my only question I have. The wellness program that is rolled out, is it on a tender process, and is it only frontline staff that are being looked after? Thank you.
Thank you very much, Ms. Kivitz. HOD.
Thank you, Chairperson, and thank you for the question from Ms. Kivitz. I can say to you that the wellness program is aimed at all staff. So that is office-based staff, frontline staff, management, and all components of staff, and even in the facilities, the support staff in terms of that. So, and the way it is a metropolitan contract. The contract is done by the Department of the Premier as a transversal contract for all Western Cape government departments. The health department being one of the departments with the biggest number of staff members, and our history of using employee wellness is probably the biggest user of that contract with Metropolitan. And what you see, the money that's been allocated for this year, is the 5 million, is a top up on top of that, so that we bring in the additional services, which is really about intentional healing and grieving for all staff members. Mr. K can add if he wishes to that, but Ms. Kivitz, we are extremely proud of this program, and we are taking it very seriously. What I can just add is Mr. K has also got a forum with organized labor, where we are looking at occupational health and safety as an important issue. And he, through that, us and organized labor very much work together after looking at all the staff members from an occupational health and safety perspective and well-being from that perspective. Mr. K?
Thank you, HOD, and thank you for the question, Ms. Kivitz. I think there's kind of two elements to the staff wellness. We've spoken about the formal program, but we've also intentionally looked at the culture of the organization to create the spaces where we can connect with each other beyond the formal spaces. So there are a lot of daily huddles that happen, and we focus on allowing and giving people the space to really reflect on their humanity. And that's part of the staff wellness journey, and that staff wellness journey exists and extends beyond the front line. It's all encompassing, and it extends to families too. Unfortunately, one of the staff members who passed on was one of our chief directors, the person who would have been doing this presentation, the chief director for finance, unfortunately passed on the 30th of December. And we were able to use our program to reach out to his family at the same time, and we have reached out beyond just staff to family. We've facilitated transport of bodies. We've facilitated a lot of additional aspects and elements of staff wellness. I think for us, one of our key tenements has been staff safety, and whether that is the physical barrier with PPE, which has been a real focus, or the emotional well-being of our staff. It really has been something that we've intentionally invested in, and a journey that we've intentionally moved on. And we couldn't have done it without a partnership with organized labor. We have a very open and frank relationship with organized labor, where we invest a lot more in relational power than positional power. We don't bring any airs and graces to that table. We all treat each other as human beings. We have spent a lot of time bringing experts into big Zoom engagements, where we've engaged directly with the shop stewards, who have then been able to ask the questions that are coming from their members of the specialists, so that they can take that information back. Because the simple fact of the matter is, organized labor are an incredibly important partner. People listen and take what organized labor say very seriously, and we treat them as an equal partner in this space. And we've seen fruits of the labor, both from the departmental side as well as from organized labor side. Thank you very much, Chairperson.
Thank you so much, Mr. K. Members, if there are no other comments from your side at this stage, I will now afford Minister Mbombo to do her closing remarks.
Chair, my hand was up.
Apologies, Member Mackenzie. Please proceed.
Thank you, Chair. Just before Member Mbombo closes, now this is also applicable to her as well. We know what the department's gone through. We know what tens and thousands of our medical staff members has gone through. It's not only applicable to the staff, I mean, including the minister, her HOD, and all the top officials that normally comes to this committee. That, their wellness is important to us, because if they're not going to be around, we can't replace them. And we know the HOD recently went on a few days leave, but including the minister needs to take a bit of a break, the chief directors, the COO, all those people, the hospital boards, the specialists, because we are going into a third wave and possibly a fourth wave, and we cannot have our best players being substitutes in the future. We need them on the field, we need them to score goals, and their health is important to us. So from the minister onwards to the top management team needs to take a bit of a break, even if it means this committee has to make a resolution in that regard, because we do need them fresh. So it's actually a very serious matter. We've seen how people burn out, and we don't want our colleagues who's currently in the forefront of this battle being burned out, and we need them at their best, and they can only be at their best if they take care of their personal health. Thank you.
Echo your sentiments completely, Member Mackenzie. I actually thought that you were volunteering to stand in, but thank you so much. That is indeed the case. Minister Mbombo, over to you.
Thank you, Chair. Thank you, honorable members. Also thanks to the staff that are here, including the support staff from the legislature and support staff from the department and also from the ministry. Chair, as I indicated earlier, that it's one of those years where the budget, the public purse is shrinking. But in as much as that it is shrinking, one thing for sure that we guarantee is about the quality service. Jokingly, I was saying to someone that as a Western Cape, we're still going to bring the boboti, but now the boboti won't have an egg and also probably a topping of a cheese, but it's still going to be the same ingredients. But that boboti, instead of now it being in a big dish, it means that the dish have to be decreased so that we have to maintain the quality. Lastly, Chair, again, I normally remind the colleagues in terms of what systems that the health system has to strengthen in order for us to deliver the services, starting with the leadership and the governance. We want to thank our management. It is true, Member Mackenzie, that he, I was just excited that I hear that even Dr. Wayne Smith, who's the specialist in the emergency medicine, who has been at the forefront at the time that we had our first case, if you recall at the time that it was from the international travelers, where together with his team, they have to keep to and fro going to the airport to fetch the cases, people likely potential to be cases, whilst the vaccine was unknown. And also for Dr. Klute and his team has indicated that when he was baptized, took over from Dr. Beth Engelbrach, I don't think he knew that it will ended up being like this. And as much as that he has been in the department for the past 30 years, but it's completely different. It's a different situation. So thank you very much for that. So that leadership and governance, it's one that we are always proud of as a Western Cape, because we still have got more of the same stuff that has been even before some of us even joined the department. So it's a team that has also been exposed to a lot of the challenges, but the resilience that is there, it makes it to be easier for them, even if there is a need for some things that will be done now, to have a hospital for with less than 6 weeks, they could be able to, because they know each other. And also lastly, because they are clinicians themselves. Yes, people might think some of them, they are just managers, but how they think, they bring matters of the heart into the workplace, because it's not only about matters of the head, having the whole lot of knowledge, matters of the hands, where they've got a whole lot of the skills, but also they bring the heart into it. So this budget it's about also thinking more than that we have to deliver the service as according to PFMA or is according to PSA or whatever, but it's about where we have to bring the matters of the heart, but it's about the people. The human resource, the workforce, our staff, as Chair, we indicated that we have underwent quite a very challenging year, not only about the deaths, but also about the families of the staff that are being also affected and infected. Where at the beginning, Chair, because I have to highlight because we have just had an annual commemoration of the year within the COVID space. Chair, it's about like in the beginning where you find that actually they are also stigmatized. There was a time where they will say people that, oh, there is that taxi from Kailicha area with a staff working in Tygerberg, where they couldn't be able, some of them going to the shops because they'll say, oh, you are bringing COVID. So they were stigmatized because some of them are being known that you are Dr. So-and-so or your sister so-and-so who's working in a hospital, you are might be bringing the COVID. Similar applies to some of us, even although we are politicians, when we have been hopping and gallivanting throughout. It was about trying to strengthen the staff that we are not leaving you behind. We are always there for you. Coming Jerusalem or Limpopo will always be with you. And then in regard to information system, which has been strengthened, as you heard, Chair, that we won quite several of the awards where we're competing with the private, where we have always been there when it comes to the dashboard system, providing the information to everyone, the people of the Western Cape, with the Premier assisting in regard to the Premier Digicon. So that we not only it ended up being our health problem, but throughout, from the colleagues in other departments, from the members of the parliament, from your guys, and also from the mayors and everyone. So it has always been there, but that we have managed in terms of mastering the dashboard, which also made us even to be easier to be able to do even some of these rollout for the chronic medications as a part of our information system, which is a part of the system. The issue of the finance shares, as we are stable in the finance, but that despite the challenges, by the way, if maybe you are not aware, the AG does a parallel auditing for the coronavirus resources. So in the first 3 months since July, where you have to table, especially the supply chain stuff, where each and every item has to be audited. This is in parallel to the mainstream auditing that has been happening. So that's why even our annual report was delayed in the all provincial departments of health. But for the staff that have to be able to master, where we never stole any PPEs, Chair, nothing. We use the money that was allocated to us accordingly, which is we are going to use even the same money that is being allocated for now accordingly. So it's not a surprise that we are getting a clean audit for the second time. But as we always say, that there is no guarantee that we might even get another one, because as we know that with the 2020-2021, it has been quite tough year. So we'll see how we can be able to rob Paul and pay Pauline so that we can bring service to Auntie Sarah somewhere there in Maritzburg or wherever she is. And then lastly, the availability of the medicine. One of the reasons that we are pushing for make sure that we have got a plan to complement and supplement the national program on the vaccine is part of the strengthening the health system. So availability of medicine is part of the building block. It is a system on its own. So we cannot only focus that to have a Panado, to have a diabetic treatment, to have a urine dipsticks, to have a BP machine, and yet we're in COVID. We're not talking about the availability of the vaccines. It is a must, because that's when things could be able to be normal, where we can vaccinate all 5.1 million of our staff in the Western Cape in order to be able at least to be relaxed. For now, we cannot relax. So availability of medicine is another system. And then in order to deliver those kind of service packages that we need, it takes me to the last block system, which is services that we render. It's really painful to know that we have to reduce packages. because this province is known for many, especially the cutting edge surgeries, starting from for example, the removal of the lungs, transplants, and all of those. It's sad that you realize that now, because of the COVID, we have to prioritize that budget-wise, and also because in terms of the state where we are, there are many of some of these specialists who might not be able to conduct such. Because as you know, just like flying an aeroplane, if you don't fly much and get miles, it seems similar with when you are a specialist. You have to make a point that you have to keep on sharpening your skills. So it's really unfortunate. Like even if with the breast cancer, chemotherapy, operations, and all of those, it's really sad that we might not be able to bring some of the non-COVID cases, but at least balancing in regard to some of the services that are very crucial, where if you don't do them, it will end up having quite a large negative impact, as I indicated earlier, with HIV, AIDS, TB, child, and all of those. Lastly, the system that has never been there, but we're adding it as the Western Cape, is a people system. People come first. As I used to say, that nothing about the people without the people, because if there are no patients, it means that they will never be able to be delivering to who. So the voice of the patient still matters. So whatever we do it for the patient. But people as well, because when you ask questions, especially from Member Van Gogh, normal ask, so how will they be able to know? And Member Mackenzie, the communication. It's because we have to prioritize the people. Once we have got the statutory bodies, like the clinic committees, the hospital boards that are representing the people, but in the state of being in COVID, it makes it quite challenging to involve all these stakeholders. The people include also our partners, the private health, which I want also to thank, especially now in regard to them bringing their own staff also for the vaccination. It's also part of the people. It's the people also in regard to what this budget is all about. It's all about the people. So we must never forget that whatever we do it for the anti-SARA. It's about everyone who is there. And the reason that we wake up in the morning now, thank you, Member Mackenzie, for taking a break. The reason that we have never taken a break, Norma French Mbombo, I've never taken a break, by the way, even in December. No, Chair, I've never. But it's not about that. I feel like I do have an obligation, but it's about, at the end, you won't be able to sleep at night, knowing that there are people who are working 24 hours. I was a health professional. I work in every spheres of government. As a nurse, I know how it feels. I know how it feels when I was teaching the students for the next 15 years, who most of them actually are the ones who are working in this province because they were my products. I know it very well, how people have been scary as healthcare professionals coming to work. So it cannot be when you lead behind, you leave others. So you need to show the way that I'm not afraid, I'm scared, but I'm not afraid. Therefore, I'll always be with you no matter what. But now it's true, Member Mackenzie, now that at least we have seen the drop, the plateauing of the cases, and also in terms of the drop, in terms of the numbers and all other landmarks related to the COVID, we need to take a break. Besides that, remember some of the statutory obligations in regard to the leave and whatever, some of them might not necessarily see there's a need for the leave, or that there is a time to take a leave, but you are being forced to take a leave because your days, I'm talking now about the staff, the officials, will end up disappear, or because we don't have money to pay you back those leaves that you don't take. So members, thank you very much for allowing us to engage on this budget. I hereby table the 27.391.897 billion budget for the Western Cape, a budget for the people. Thank you.
Thank you very much, Mr. Mbombo. And I think I can speak quite comfortably on behalf of the committee when I say thank you for your exceptional leadership. We found you throughout this grueling times that you were not the minister that sat behind a desk. And at no point did you ever were not able to, either yourself or the department, the HOD as well, to come and account to this committee. We are deeply appreciative of that. There was no point that you or the HOD or the officials ever told us that you do not know. So we are indeed in safe hands, and thank you so much for your commitment. Thank you so much for your dedication. Thank you so much that we know that you've been out there crisscrossing this province to make sure that our health system are intact. Thank you to all for providing us today with a budget of hope that speeds up vaccination to defeat COVID-19 in the Western Cape. And also, as you made mention, juggling here and there, but to retain our services in order to provide to all communities in the Western Cape. Thank you so much for a budget that makes provision for the procurement and the rollout of additional vaccines. Thank you so much for a budget that helps residents understand the benefits of getting those vaccines. And thank you so much for a budget that will be able to respond to a possible third wave in the Western Cape. We are deeply grateful. Thank you, Minister Mbombo. Thank you, Dr. Keith Kloete. Thank you, Mr. Kay. Thank you, Dr. Angeletti de Tooy. Thank you to all officials from the department for availing yourself today and being ready for any question that may come your way. I also wish to thank our member of the public, our guest, Mr. Maris Kivitz. Thank you that you are all so much involved with the community and also always willing and able to come and engage with this community and interrogate and deliberate vigorously on what counts to the communities out there. At this point, I wish to thank everyone for not members, but the minister, the department, and our guests. Thank you so much for this morning, for your deliberations. We do appreciate that very much. We will now excuse you. Thank you.
Thank you, Madam Chair.
Thank you.
Thank you,
Bye,
Chairperson.
bye.
Thank you, Chairman.
Members, we do have some time to our advantage. At this point, we can deal with resolutions or any action points from your side based on the two submissions made this morning. And then I believe we also do have time to our disposal to even adopt our report as well. So at this point, members, any resolution or action steps from your side? Nothing, members?
Chair, we can see.
Member Barnes and then Member Mitchell.
Thank you, Chair. I just think one resolution of mine must be captured, the one where the department promised to send out a report on the infrastructure question I had earlier. Thank you.
That's duly noted, Member Barnes, of which Dr. Angeletti de Tooy will provide the information. Member Mitchell and then Member Mackenzie.
No, Chair, nothing from my side.
Thank you. Member Mackenzie.
Thank you, Chair. Just the one item that I've requested, the one is on just the mobile distribution plan or the strategy that they're going to start advertising in the tender run, so one can just see where it's rolled out in the Western Cape now that they brought it in-house. And I'm just thinking about the other thing I requested. Sure. Okay, I'll still think about it now in the meantime.
Sure. If it doesn't come up, you are most welcome to email to myself and the procedural officer. Thank you, Ms. Jamke, for flagging. Member Barnes, is that an old hand?
Yes, Chair.
Members, the report are flagged. Can everyone see the draft committee report?
Yes, we can.
Thank you, Member Botha. Members, I now table before you the draft committee report of the Standing Committee on Health on vote 6, Health in the Schedule to the Western Cape Third Adjustment Appropriation Bill 2020-21 financial year, B3 2021, dated 17 March 2021, or rather 17 March 2021 as follows. The Standing Committee on Health, having deliberated on the subject of vote 6, Health in the Schedule to the Western Cape Third Adjustments Appropriation Bill 2020-21 financial year, B3 2021, refer to the committee in accordance with Standing Rule 188, reports that it either supports or does not support the vote. Can you kindly indicate, members?
Chair, my proposal.
I recognize you, Member Botha.
Thank you that this committee supports the vote.
Thank you, Member Botha. Member Allen.
Thank you, Chairperson. I wanted to echo the same sentiment as expressed, that the committee support. Thank you.
Appreciate. Thank you, Member Allen. Member Van Vogel.
Chairperson, yeah, that just know that the ANC are not supporting the bill. Thank you.
Thank you very much, Member Van Vogel. Ms. Jamke, before I go to you, Member Kego.
Thanks very much, Chair. The EFF also does not support the vote. Thanks very much.
Thank you very much. We thus indicate the minority view.
Yes, Chair, the report will reflect the minority view in terms of Rule 90 for the EFF and ANC, that they do not support the vote. But I will flag the report now, just an example of how it look like.
Yes, please.
Can you see it, Chair?
Not yet. We are seeing a Teams screen.
Okay, let me try again. And now?
Yes. Thank you. Perfect. Just to read out for the record, the draft committee report on the Standing Committee of Health on vote 6, Health in the Schedule to the Western Cape Appropriation Bill B4 2021, dated 17 March 2021 as follows. That the Standing Committee on Health, having deliberated on the subject of vote 6, Health in the Schedule to the Western Cape Appropriation Bill B4 of 2021, refer to the committee in accordance with Standing Rule 188, reports that it supports the vote in terms of the recording of the minority view in accordance with Standing Rule 90, the African National Congress and the EFF expressed a minority view to not support the vote. Is that a true reflection, members? Can we agree?
Agree,
Yes,
Chair?
yes.
Great, Chair.
Yes, Chair.
Thank you very much. Ms. Jamke, at this point, do we have any other in-house business to conclude?
Yes, Chair, we can adopt now the report for the budget for 2021-2022. Now let me check my... Please give me some time, Chair.
Sure, Ms. Jamke. And now, We should have otherwise adopted on the 23rd, but since we do have the time to our disposal now. So thank you so much for your efforts as well.
My computer is a little bit slow today. Okay. Oh, the wrong one. Okay, Chair.
Thank you very much, Ms. Jamke. Report of the Standing Committee on Health on Vote 6 in the schedule to the Western Cape Appropriation Bill B4 of 2021 dated 17 March 2021 as follows, that the Standing Committee on Health, having deliberated on the subject of Vote 6, health in the schedule to the Western Cape Appropriation Bill B4 2021, referred to the committee in accordance with Standing Rule 188, reports that the committee supports the vote or either does not support the vote. Can members kindly indicate such?
Chair, Member Botha, that the committee supports the vote.
Thank you, Member Botha. I
Yes,
see
that we
Member
support.
Allen.
That we support. Thank you.
Thank you, Member Allen. Are we in concurrence? Thank you very much, members. Member Tejo?
Thanks, Chair. No, the EFF does not support.
Thank you, Member. We will report the minority view in accordance. Thank you very much, Ms. Jamke. For the record, the report of the Standing Committee on Health on Vote 6, health in the schedule to the Western Cape Appropriation Bill B4 2021. And now it disappeared on me, dated 17 March 2021 as follows. The Standing Committee on Health, having deliberated on the subject of Vote 6, health in the schedule to the Western Cape Appropriation Bill B4 of 2021, referred to the committee in accordance with Standing Rule 188, reports that it supports the vote. Minority view is recorded in this regard, and in accordance with Standing Rule 90, the EFF expressed a minority view to not support the vote. Are we in concurrence, as this is a true reflection, members?
That is a true reflection, Chair, that transpired.
Thank you so much, Member Botha. Members, or rather Ms. Jamke, anything else that we need to take care of?
I think, Chairperson, we are done for the day. Now, with the adoption of the reports, of the two reports that we were supposed to adopt on the 23rd, which is Tuesday, I'm not sure if the committee is going to still have that meeting and adopt maybe the minutes and the other documents, or maybe the documents can wait for the next committee meeting, which is, it will be after the constituency period.
What is the feel of the members?
Chair, my hand is raised. Yeah, thank you, Chairperson. I would propose that it stands over, Chairperson.
Are we in concurrence, members?
I second to that one, Chair.
Thank you so much, members. Ms. Jamke, then it will stand over till after the constituency period. Am I correct?
Yes, Chair, it will after the constituency period. And the other matter is the responses from the Department of Health. I received the email yesterday, but I have not shared it with the rest of the members, which is the process that the committee requested from the Office of the Minister to give clarity on how the members of Parliament can be appointed to the hospital board. We received the response yesterday. I will just forward it to the members soon. Maybe that matter can also be discussed in the next committee meeting.
Sure, we will have to. Thank you very much, Ms. Jamke. Can you kindly at soonest share that information with the committee members? Thank you so much. Ms. Jamke, thank you so much for all your assistance today. Thank you for all your efforts. Thank you, Mr. Shiraz, for your assistance as well. Mr. Daza, Ms. Candice Morris, all our other support staff as well. And thank you very much to all members for your valuable input and deliberations this morning. Thank you so much. Have a blessed day further. And please do keep safe. Thank you so much. The meeting
Chair,
is now.
thanks for your direction as well.
Thank you, Chair.
Keep well, everyone.
Thank you. Bye.